warahmatullahi wabarakatuh.
Good morning and welcome to the second day of International Conference on Health and Sciences 2021. It is an honor to us to welcome our invited guests and speakers at our table, Mr. Wikan Sakarinto, PhD, the Director General of Vocational Higher Education,
Mr. Joko Susilo, SPM MKes, the Director of Health Polytechnic Ministry of Health, Yogyakarta.
Professor Dian CM from University of Rhode Island, USA,
Mrs. Jackie S. Rales from the International Federation of Nurse Anesthetists, USA.
Mrs. Jackie S. Rales from International Federation of Nurse Anesthetists, USA,
Mr. Niko Tesni Saputro, MPH from Health Polytechnic Ministry of Health, Yogyakarta.
Mr. Diki Budiman, PhD from Griffith University,
Professor Anna Peters from Deakin University, Australia.
Professor Serap EA from Ataturk University, Turkey,
And Professor Marzuki bin Ishaq from the Academy of Occupational and Environmental Medicine, Malaysia.
and also we are very glad to welcome the organizers and more than 1,000 both domestic and abroad registered participants who attend this conference through Zoom meetings.
And ladies and gentlemen, we will announce several information and today's schedule.
And the announcements are certificates for participants who register through website can be received and downloaded in their account. Certificates from participants who register through SICAP or PTGMI can be downloaded in their account. And certificates for participants who register through the Google form or student transfer level can be downloaded through the Serpo Poltekkes Yogyakarta.
And today's event will be divided into two keynote speech sessions. For the first session, a keynote is from Professor Dian Kokoza Martins from the University of Rhode Island, USA, with the topic COVID-19 pandemic, lesson learned and future direction in the US from the community health nursing viewpoint at 9 a.m. And the second keynote is from Mr. Wikan Sakarinto, PhD, from the Directorate General of Vocational Higher Education, with the topic of the role of vocational college in realizing a healthy city at 1 p.m.
And also, there were two parallel sessions. The first at 10:30 a.m. with the speakers, Dr. Niluh Putu Eka Sudiwati from Poltekkes Malang on recruiting COVID convalescent plasma donors during pandemic, challenge and answer.
And the room 2 is Mrs. Jackie S. Rowles from the International Federation of Nurse Anesthetists, USA, and the role of nurse anesthetists in universal health.
And also in room 3 is from Professor Armah Binti Tengah from Polytechnic Brunei about the challenge to nursing education during pandemic, Brunei Darussalam perspective.
And the room 4 is Mr. Niko Tesni Saputro, MPH from the Health Polytechnic Ministry of Health, Yogyakarta, on medical record borrowing control, design tools, tracer and outguide.
And for the second session at 2:30 p.m. with the speakers are Mr. Bondan Palestine from Poltekkes Yogyakarta, Dr. Heni Pujiwahyuningsih from Poltekkes Yogyakarta, and Mr. Zaini Dahlan, MPH from Indonesian Oral Health Therapists Association.
This event is collaboration with various university partners, both from within and outside the country, such as St. Paul University, Philippines,
Health Polytechnic Ministry of Health Palu,
Health Polytechnic Ministry of Health Banjarmasin,
Health Polytechnic Ministry of Health Denpasar,
Health Polytechnic Ministry of Health Palembang,
Health Polytechnic Ministry of Health Pangkal Pinang,
University Medical Suherman,
Nursing Academy YKY Yogyakarta,
Center of Excellence Polytechnic Ministry of Health Ternate,
Center of Excellence Applied Health Technology on Public Health Polytechnic Ministry of Health Yogyakarta,
as well as the sponsorship of BNI 46 Bank, FDC Dental Care and Integrity Company,
and also support from professional organizations from Indonesian Association of Medical Laboratory Technologies,
the Indonesian Nutrition Association,
Indonesian Midwives Association,
Indonesian National Nurse Association,
Indonesian Environmental Health Expert Association,
Indonesian Oral Health Therapist Association.
And ladies and gentlemen, let me read our schedule for today. We have the first session.
For the first session is first keynote from Professor Dian CM from the University of Rhode Island, USA, and the first parallel session which divided into 4 breakout rooms.
And for the second session, after break, we have the second keynote session from Minister of Education, Republic of Indonesia. And second parallel session, which will be divided into 3 breakout rooms and continued by the oral presentation. And then for the last agenda today is the closing ceremony. Ladies and gentlemen, to open our first session, we will go to the keynote session 1, presentation by Professor Dian Cocoza Martins from University of Rhode Island, USA, by the topic of COVID-19 pandemic, lesson learned and future direction in the US from the community health nursing viewpoint.
In our first session, we will be guided by Dr. Agus Karmayana from the Health Polytechnic Ministry of Health, Yogyakarta. Okay, to know him better, let me introduce him profile from her CV.
Ladies and gentlemen, we do apologize for our mistake. For today's moderator is Dr. Catherine from St. Paul University. Let me approach her first. Dr. Catherine, hello.
Yes. Yes,
Am
I'm
I
here.
audible?
Yeah, very audible. Thank you.
Thank you very much. Ladies and gentlemen, since Dr. Catherine is already here with us, this is the time for us to give this opportunity to her. For Dr. Catherine, the time is yours.
Pleasant morning to everyone. May I introduce to you our presenter for today, who will speak to us on COVID-19 pandemic, lessons learned and future directions in the US from the community health nursing viewpoint. Her teaching, research, and service commitments are to public health, community health nursing, and vulnerable populations. She has presented her work nationally and internationally. She is a fellow in the American Academy of Nursing in recognition of her contributions to the disenfranchised vulnerable, and homeless populations. She is also a faculty member in the interdisciplinary Rhode Island Geriatric Education Center, funded by the U.S. Department of Health and Human Service Administration. She is currently a co-project coordinator on HHS SAMHSA grant for a community first responder program for opioid education in rural communities. At the University of Rhode Island, she has been a multicultural faculty fellow and interdisciplinary faculty fellow in geriatrics and gerontology, faculty in the President's Partnership for Food, Hunger, and Nutrition, and a faculty fellow in public service and ethics. She is the recipient of many awards, including the Nightingale Award from the Rhode Island State Nurses Association. She is currently a member of the Board of Directors for Partnership to Reduce Cancer in Rhode Island Department of Health. Her research on vulnerable populations in the community, homeless persons' healthcare experiences, food insufficiency, the lives of women facing adversity, are methods to increase nursing students' knowledge and appreciation with older adults in the community and with the prison population. Her education includes PhD, University of Connecticut, Master of Arts, Medical Sociology, University of Connecticut, Master of Education, Nursing Education, Columbia University, Bachelor of Science in Nursing in Salve Regina University. Her some selected publications are Missed Opportunities to Immunize Young Adult Males with the HPV Vaccine to Reduce Oropharyngeal Cancer, Coping with Mental Health Issues Among Older Hispanic Adults, Perceptions of Mental Health Among Older Hispanic Adults from the Dominican Republic, Guatemala, and Colombia, The Meaning of Home Among Hispanic Older Persons Living in the United States, Exploring the Use Critical Reflective Inquiry with Nursing Students Participating in an International Service Learning Experience, Assessment of Food Intake, Obesity, and Health Risk Among People who are Homeless in Rhode Island, and many more. Her book chapters also include Critical Interactionism, a Theoretical Bridge for Understanding Complex Human Conditions, Thinking Upstream, Nursing Process and Population-Focused Nursing Practice, Community Health Planning Implementation and Evaluation, Nursing Practice and Licensure Across Borders, Resilience in Aging, and lastly, Application of Critical Reflective Inquiry in Nursing Education. Ladies and gentlemen, may we now have Dr. Diane Cocoza Martins, PhD, RN, FAAN. You may have the floor now, Dr. Martin.
Will you be using my video presentation?
Yeah.
Thank you. And thank you for that lovely introduction. I'm very
Thank you
honored.
very much.
Greetings. It is with great pleasure that I speak to you today from the United States of America, from the state of Rhode Island, from the University of Rhode Island, College of Nursing. I'd like to speak with you about the COVID-19 pandemic and the lessons that we've learned and our future direction here in the U.S. from a community health nursing viewpoint. Thank you for your invitation to present at this most prestigious conference, the 8th International Conference on Health Sciences. To start with a bit of a background, the Center of Disease Control had a public health response to the initiation and the spread of pandemic COVID-19 here in the United States from February of 2020 to April of 2020. As most know, the first condemned coronavirus case in the U.S. was reported on January 21st of 2020. The outbreak appeared contained at that time through February. However, it accelerated rapidly. Factors that contributed to the spread were continued travel association importations, large gatherings, introduction into high-risk workplaces, densely populated areas, limited testing, and asymptomatic and pre-symptomatic spread. What are the implications for public health practice here? Perhaps targeted and community-wide mitigation efforts were needed then and continue now to slow transmission. The background of COVID-19 in the USA can be outlined in these three areas. One is the COVID-19 pandemic in the U.S. was part of a worldwide pandemic of coronavirus disease starting in 2019. The first case that was reported on January 21st was declared at the initiation as a public health emergency by former President Trump. This initial U.S. response to the pandemic was otherwise quite slow in terms of preparing the healthcare system and stopping other travel and testing. In spring of 2020, COVID-19 cases were rising. One particularly private university that kept thorough track of the rise in cases throughout the United States was the Johns Hopkins University site on COVID. It was particularly noted in the early stages that the most densely populated areas of the United States, such as California, New York, New Jersey, and much of the northeast and southeastern United States, had the most number of confirmed cases, as depicted in this chart created by Johns Hopkins University. The impact of COVID-19 in spring 2020 from our public health nursing perspective was quite a roller coaster ride in many ways. At the beginning time, there was so much uncertainty about this new coronavirus. We began to notice as nurses that our intensive care units became full. They became full to the point that there was no more room in the units. Throughout the Northeast, the government needed to open tent facilities where the Army National Guard went in and opened up new sites to put people under tents on stretchers with equipment borrowed from other parts of the country. There was a mass exit at that time for those in the urban core from people that had the means to escape the urban core. So those that had more affluence were able to escape from the cities such as New York or perhaps in New Jersey, and they would then move out to the suburbs of that particular state or to surrounding states that had less cases. This was all quite visible to people in the city because they saw the long lines starting to develop outside of the hospital facilities. By spring of 2020, particularly by March, the nurses across the country began to note that most schools began to close at all levels, from preschools through kindergarten, through high school, straight through college and graduate school. Children were sent home to learn on their computers if they had one and if they had internet. People were losing jobs due to closures, not just from schools, but also people were losing jobs in industry. This particular table demonstrates the industries with the absolute declines that were experienced from February to September 2020 just in Manhattan, in New York City. And you can see that many lost jobs. 76% of food service and drinking places, arts and entertainment, 86% lost their jobs. Retail trade throughout the city at 69%. Hotels and motels, 98% of the people that work there lost their jobs. You can see this move down from professional and technical services to administrative and support services, educational services, the motion picture and sound recording jobs, wholesale trade, and social assistance. Another impact of COVID-19 in the spring of 2020 from a public health nurse's perspective were the issues going on about mask utilization. Who should wear a mask, how you should wear a mask, what material a mask should be made of. But this was not only a public concern at the very beginning, this was an issue for first-line workers, those nurses, those doctors, the emergency medical technicians, and long-term facility care staff were all lacking in personal protective equipment, including masks designed to give them the most protection. And all this was occurring most intensely in New York City as its epicenter. Another impact of COVID-19 from a public health nurse's perspective what was going on with populations who were most affected by the COVID-19 infection. One of the first that we began to note were older adults in long-term care facilities, which we have many more of than many other countries in the world. We have many of our older adults living in aggregate space or conjugate living, where they live with other older adults and they're cared for by nursing assistants and nurses within that environment. They live, they sleep, and they eat in that environment. The older adults in these facilities were getting very high rates of COVID-19, and many were advancing, particularly those that were older across the continuum. Others that were becoming ill and most affected were those with comorbidities, such as obesity or diabetes or heart disease. The other population that we saw a big rise in were those that had racial and ethnic backgrounds that were part of minority groups, and this was also noted in people with low-income backgrounds. COVID-19 was quite clearly a pandemic that demonstrated our weakest points in terms of racial and ethnic injustices here in the United States. Here is a photo that was depicting healthcare workers basically saying, "It's not right. Stop killing us." The healthcare workers at Brooklyn's King's Hospital show solidarity with the Black Lives Matter movement during the coronavirus pandemic. Here is a chart created by the Center of Disease Control where they clearly show the cases of COVID, hospitalization, and death by race and ethnicity. You can see the cases for those that are Black or African American, or those that are Hispanic or Latino persons, is 2.6 to 2.8 times higher than the general population. We can see that hospitalization was 5.3 times higher for American Indians, Alaskan Natives, and non-Hispanic persons, but 4.7 times higher in Black and African American persons, as well as those at 4.6 times higher for those of Hispanic or Latino origin. Death was higher, 1.4 times higher with American Indians and Alaskan Natives, and death was 2.1 times higher in Black and African American citizens. In one early article in 2020, there was a release about COVID-19 and its correlation to the social determinants of health. It was reported in the American Journal of Health Promotion. And they were letting us know that adults with social determinants of health risk factors may be more vulnerable to COVID-19. So this not only included what we were already seeing in terms of race and ethnicity, but it also showed us that people that lived in neighborhoods and housing in poorer neighborhoods, those who had less access to food, those with less access to education or lower education, those in occupations where they couldn't move to working remotely, that there were no jobs for them if they needed to be face-to-face. Transportation was problematic for people that needed to get testing or needed to get to the hospital, and generally those who had unequal access to quality health care. Also, the problems with COVID-19 came with some really strong mixed messages and uncertainty from the federal level. At the national government level in the United States, it was very hard to follow what was going on. There were variations in mask mandates and mask beliefs, being told different recommendations whether you lived in the Northeast, the Southeast, the center of the country, the West Coast. And this difference made it so there was very unequal general message to the people at the federal level. There was uncertainty about medical supplies. Where were our respirators going to come from? Where would we get enough nurses? How would we have personal protective equipment? Also, there were beliefs and attitudes about COVID-19 testing that were varied state by state in the United States. Some governors in each state believed very much in supporting the school shutdowns, mask mandates, COVID testing wherever possible, and helping people get to that testing. Guidelines for contact tracing, rules of isolations, and rules of quarantine varied and came up with those mixed messages. Treatment confusion was also present. According to an article in Scientific American in March of 21, they looked back to see how the U.S. pandemic response went wrong during that year. And some of the themes that they developed to talk about that response that went wrong was the downplaying the danger and sidelining experts. So as experts spoke, some members of the federal government would comment and give other suggestions for what people would follow. There was also very slow and flawed testing at the beginning. Not enough test kits were sent out. There was inadequate tracing in the beginning. People not doing correct isolation and quarantine. There were confusing mask mandates, as I mentioned before. There was also confusion about whether COVID-19 was airborne spread or was it spread through hygiene. And so the two campaigns were going on, one with masks and isolation and one with washing hands and washing surfaces. The other theme or the other area present that really affected this was the issue with structural racism, which only became more evident as we began to see the health inequities with COVID-19 disease. And perhaps one that many other countries have commented on was our decentralized approach. The President of the U.S. gave the responsibility to each of the 50 states to make their decisions about what to do in terms of COVID-19, rather than coming up with a planned that worked as a centralized plan for the entire country. Some COVID myths, they were persistent false claims about the pandemic that occurred throughout the beginning of the pandemic. One was that conservative media and conservative politicians were saying COVID-19 is no worse than the general flu, that you don't really need to wear a mask. There were some conservative news stations, including the president at the time, recommending hydroxychloroquine as an effective treatment. Another issue was that Black Lives Matter's protests were going on in that time period. But if you saw most of the videos or the images from the Black Lives Matter's protests, almost all the members had masks on. But people in the conservative media were trying to blame that on the transmission within those communities. So another myth was that the spike in cases in certain areas was because there was just too much testing. Another myth was that we thought we could achieve herd immunity by letting the virus spread through the population, and any vaccine would be unsafe and bigger risk than getting COVID was another risk. Presently, there is a new myth that's going on here in the U.S., which is that ivermectin can be used as a treatment, and this was recommended by conservative media. This does not work. However, there are many people that follow that more conservative way of thinking in the United States, and so they're trying to take this anti-parasitic drug, which should be used only for livestock. Some of the social, political, economic, and psychological consequences of COVID-19, particularly social, is the confusion and isolation of what was going on, people being unsure of who to believe. For those that were already feeling isolated, the pandemic magnified that isolation. That pandemic magnified fear and anxiety and depression throughout the United States, not only for adults, older adults, and children as well. Socially, we began to realize that low-income and minority communities had greater risk of illness and hospitalization. We realized that politically, the pandemic divided completely along party lines, so that you had conservative thinking, which is in the United States considered the red states, and you had liberal thinking, which in the United States are considered the blue states. And it was divided so that the blue states, or the liberal thinking, said we have to listen to science. The conservative states, or those that are referred to as red states, did not believe in science. And another consequence of COVID was the economic consequence of businesses closing, loss of jobs, loss of income, lack of food, etc. You can see in this particular diagram that the vaccine hesitancy, or those areas of the United States that are hesitant to take a vaccine because they're afraid of it, which is probably about anywhere from about 40% to perhaps 25% of the country, depending on the region. Here you can see that vaccine hesitancy is very low, or depicted in blue and dark blue, in the East Coast, the West Coast, and the North, and parts of Florida. But then you can see the hesitancy, the rates are higher, such as being at 30% and greater in the southern belt, as well as the Midwestern region. And those areas that have more red and yellow tend to be more of the red states, or the conservative states. So, what went right? According to Scientific American in 2021, the first thing that started to go right was the development of vaccines. Also, the heroic efforts throughout the pandemic from day one of healthcare workers throughout the United States. Also, for the most part, the public did do its part, where they recognized the importance of protecting each other in the community. And in general, news media, newsprint really worked on combating misinformation that was being presented throughout the country. The U.S. National Guard supported frontline workers and vaccination programs not only here in the state of Rhode Island, but throughout the country. They were deployed to parts of the United States that had the highest rates of illness and the greatest need throughout the pandemic, and they are still being deployed at this time in order to help regions of the country that are still experiencing high rates of COVID cases and very high rates of hospitalization. We had vaccine administration here in Rhode Island, not only from the Army National Guard, but also from many nurse and pharmacy volunteers. We were able at the beginning to administer the vaccine to about 73% of the people in the state. Overall, in Rhode Island, 66% of the people have been fully vaccinated, so they completed both 1 and 2. In the USA, there's 76.5% of the U.S. population has had at least one vaccine, and this represents all vaccine partners, including jurisdiction partners, like retail pharmacy gave the vaccines, clinics gave them, long-term care facilities, dialysis units, Federal Emergency Management Agency and Health Resources, and other federal agencies. We are continuing to do vaccines at public events here in Rhode Island and throughout the country whenever possible. This particular semester, I have students doing the vaccine clinics with me in Providence at special outdoor fairs and festivals in order to capture people that are thinking about it. This gives us our COVID-19 vaccine administration updates to September 21 or to this month. And you can see most people at this time have received the Pfizer vaccine. And in the next group, it's the Moderna vaccine in the next cluster. And then finally, J&J vaccine. Johnson & Johnson vaccine is the lowest number of people, but it was also the last vaccine to come out. Presently, in today's paper in the New York Times, they're reporting that the effectiveness of the vaccine seems to last a bit longer in Moderna, but it doesn't seem as if they can state anything yet in terms of being statistically significant, but they are monitoring that. So looking back and forward for September 2021 through September 2020. In September 2021, COVID-19 in the USA, it shows that in New York, according to the New York Times, for all people, at least one dose has gone to 64% of the people at all ages. For children 12 and up, which has been the group that we've worked on more recently, 75% have gotten at least one vaccine. And for adults 65 and older, it's been our most successful group. 93% have received at least one vaccine. We can see that in contrast, fully vaccinated throughout the country is only 55%, 12 and up is 64%, and 65 and older is at 83%. So more than 42 million confirmed cases have been reported since January of 2020, with more than 674,000 deaths, the most of any country. And this is for the United States. As of September 2021, 1 in every 500 Americans had died of COVID-19. COVID-19 was the third leading cause of death in the U.S. in 2020, behind heart disease and cancer. The U.S. life expectancy dropped by 3 years for Hispanic Americans and 2.9 years for African Americans and 1.2 years for white Americans from 2019 to 2020. So life expectancy dropped across all the categories. Hot spots continue in the United States at this very time. This particular image comes from a continuous New York Times dedicated article on the COVID-19, where they update the maps and the numbers not only throughout the United States, but throughout the world. And it's done a nice job with that as well. And so has the Johns Hopkins website done the same. They're both excellent. So now we're in September 21. So we think as COVID-19 patients again fill the hospitals, healthcare workers are still fearful. They're fighting exhaustion. I'm not sure about what's going on in many of your other countries, but here in the U.S., we have many healthcare workers leaving the workforce. They are retiring, they are resigning, they are moving to other fields. They're trying to get out of acute care, hospital nursing, and they're trying to move into community nursing, public health nursing, and they are also trying to retire if they're able to. So many on the healthcare's front line say they're baffled that after so much pain and death, there is still even a debate over whether to get vaccinated or wear a mask. So it's been very, very frustrating for them. By now, we know there's a new variant, the Delta variant, which is a very strong variant. We still have states that with no mask mandates. We have states with increasing hospitalization rates. And we still have states with very low vaccination rates. And these states with low vaccination, high hospitalization, no mask mandates, tend to be the states where we're seeing many Delta variant admissions to the hospitals. In terms of taking action, many colleges and universities across the country, including the one I work in at the University of Rhode Island, and the other schools and universities here in Rhode Island, as well as the state and federal government, have been taking a strong lead in creating mandates. I provide for you here the mandate created by Johns Hopkins University as it's moved into its phase 3 of reopening their particular university. First, they state, given the rise in COVID-19 cases in Maryland, which is the location of Johns Hopkins, in Maryland, with the Delta variant, the university has reinstated its indoor mask mandate, regardless of vaccination status. That particular mandate is also true here at the University of Rhode Island. Second, COVID-19 vaccination is required for all faculty, staff, postdoctoral fellows, and undergraduate and graduate students who will be studying or working at a U.S.-based campus or work site. 3. Only FDA-authorized COVID vaccines, Pfizer, Moderna, and J&J, will be accepted. Individuals who have shared documentation of a different vaccine will be asked to get revaccinated with one of the authorized vaccines. We also do daily pro-density health checks. Most colleges and universities have people check this on their phone and show their green check for admission to the classroom or to a building to show that they are without fever and without cough and without a positive COVID test. Fifth, once weekly COVID testing is required for all undergraduates this particular fall, twice weekly testing for those that are unvaccinated. That is not what we're doing at URI, the University of Rhode Island. We are only requiring COVID testing twice a week for those that are unvaccinated, and the unvaccinated are those that have what they call religious or medical exemptions. Here in Rhode Island, our Department of Health is not allowing religious exemptions, only medical exemptions. So any student who has a religious exemption or is not vaccinated is not allowed in our clinical sites if they are licensed under the Rhode Island Department of Health. At Johns Hopkins, they are classes and indoor events must have 50 or fewer people. We are not limiting our class size to that in Rhode Island at this time. And number 7, only essential university-sponsored travel approved by your division is permitted, and this is also true at the University of Rhode Island. In terms of COVID-19 government requirements, the government tied in the reimbursement that hospitals and healthcare facilities obtain from the government through Medicare and Medicaid by stating that they will require COVID-19 vaccination by staff within all Medicare and Medicaid certified facilities, protect both them and the patients from the virus and its more contagious Delta variant. This message has been sent out, and in Rhode Island it must take place by October 1st. If they do not comply with this recommendation at the federal level and at our Rhode Island Department of Health level, they can be terminated by October 1st of next month. Rhode Island Department of Health created mandates for the health workers, including our nursing students and our faculty. Again, all licensed healthcare providers who work in a healthcare setting that is licensed by the Rhode Island Department of Health must be vaccinated by October 1st. Those who are not vaccinated by October 1st may be subject to financial penalties or suspension of their license. The Federal Drug Administration is now recommending a COVID-19 booster for selected populations. This decision was only made in this past week, and those that were first allowed to get the booster shot for COVID-19 were the immunocompromised within the country. And the second group that was just added to this were people aged 65 and older, and that just occurred this past week. And this decision was made by the FDA. It's not originally what the President Biden had recommended. He wanted everyone to get the booster shot, but the FDA had a vaccine subcommittee that felt that based on the research at this time, those that really need it are those who are immunocompromised and those who are age 65 and older. So what are the future considerations for public health nursing? First, what will happen with the new variants? How long will immunity last? Why do some people become COVID long haulers or have those lingering symptoms? What is the future of COVID? I'd like to thank you now for this opportunity to present at this most prestigious conference. And I'll now take questions from the audience.
Thank you so much, Dr. Dayan. It was indeed a very insightful presentation. May we go now to the question and answer portion? Do you have any questions from the participants, please? Yeah, Dr. Carus, do you have any question? You're raising your hand. Sir Koirus. You may now unmute yourselves. If you have any question, please. Yes, there's a question here. Oh, I think accidentally opened the camera. Any question?
I can see a question, but I would need help to understand it.
Yeah. Yeah. It says here, salamat pagi, Dr. Diane. They say thank you very much, but I cannot understand the others.
Excuse me, Dr. Catherine and Dr. Diane.
Yes. Yes, Mr. Fritriani.
We will help you to translate if there is a question using Bahasa Indonesia.
There is. I do not know. We do not know if this is a question. It says here from Nurul Ayu to everyone. Hi to everyone. Just thanking, I think, Dr. Diane.
I am quite honored to be here. I
Yeah.
love Indonesia.
Yeah.
I wish I
Okay,
could be
so
there.
the question
Yes.
is,
We wish.
good morning, Dr. Diane. I'm Nurul Ayuniken. Is there any research
Morning.
about vaccination on under 18 years old child with CML or chronic myelocyte leukemia? Thank you.
Let me make sure I understand your question.
18 years below.
Pardon
What I
me?
heard is that you're asking if there's been any research about people under 18 for
Yes.
the
There is
vaccination.
Yes.
And we have research that shows that it's safe for children 12 and over to receive the vaccine. And in the United States, it's been opened up for all children 12 and over in the country to receive the vaccine. As of this past week, there is one vaccine that they're beginning to say can be provided to children ages 5 through 11 now, but we have not started that initiative at all yet. I do have very good friends that live in Chile, and they are vaccinating all children, and they're
Oh.
at a 99% vaccination rate. They're one of the
That's
best in
our
the world.
dream. Yes. That's our dream here in the Philippines also, Doc.
Mhm.
Is that, yeah, okay. So there's another
You're
question
welcome.
here. There's another question here, Doctor. Why is AstraZeneca vaccine not included in the list? From Arma Tenga.
I didn't realize AstraZeneca was not in the list. So I can't tell you why, but I was working at a COVID vaccine outreach booth a week and a half ago at in the city of Providence, which is our capital city for the state. And students who had just come to go to school at Brown University in Providence approached me, and they were told by the university that their AstraZeneca was not being allowed. And we received permission from our expert here in Rhode Island. He's our COVID expert physician, that we could give them one of our 3 vaccines that is recommended by their schools. And he did say it is not recommended. I did not ask him why because I had a line of people waiting. I should have asked why,
Oh,
but I don't know why. I don't think he didn't say it was not good. What he said is it's not approved here.
yeah.
Does that answer your question?
Does that answer your question, Arma? Miss Arma Tango? She's not there anymore. Okay. Dr. Diane, I have also a question. Okay, if I may, how will you describe US or the world maybe after COVID-19 pandemic?
It's a very difficult one.
Yes, I know.
I have to say that I think we all know the world has changed dramatically. You know, that we all realize how vulnerable we are as a human species, that something like this could just impact the entire globe. And it has hurt our most vulnerable populations throughout the world as well. Here in the United States, I know that the impact has caused people to experience some mental health issues. People are having a hard time going back to work. We're fortunate that we had very big government, what we call bailouts, where the government
Yes.
sent out money, extra money for people that lost their jobs. In the beginning, I worked on helping people get clothing and food, and people were relieved of paying their rents and their mortgages. So there were things that happened that helped us get through it. And I think the positive parts were the way that most people in the country did come together to keep each other safe. People were very careful. And people that lost their businesses, the money, the stimulation money that received from the government, they saved to give to people that were supposed to be working for them, but were no longer had a job there. So that wasn't everyone, but enough good things happened so that we had, for probably the first time in the United States, a sense that people had more of a community focus. We don't think like those of you that live in Indonesia and in the Philippines or, you know, in other parts of the world. We tend to be a very individualistic society. But I think COVID taught us that we couldn't stay like that. You know, we had to be thinking about each other. We had to be more of a collective society. In the long run, I hope that we can connect again face to face with people around the world.
Yeah.
I mean, I don't know about all of you, but I would much rather be sitting with you in the room,
Yes.
you know, in Indonesia.
Yes.
And because there's so much that happens with direct contact with people in terms of sharing stories and the things you can do that you can't do in a Zoom screen, you know? So I guess I would say that the impact both in the US and globally is, I think we learned a lot about our vulnerability, but I think we learned a lot about our strengths as well.
Yes. Thank you very much. No. Okay, there's one also here from UNITA WeWit. Good morning, Dr. Diane. Nice to meet you. I want to ask, how is the development of COVID-19 vaccination in USA so far? In USA, what vaccines are safe and can be given at what gestational age? And is there a vaccine development for neonates? Thank you.
Let me do it in pieces. First,
Yeah.
the COVID-19 vaccine was used as an emergency vaccine originally. And for people from the conservative thinking movement in the United States, which was relatively a strong voice under our former president, under Donald Trump. That voice is not as strong now under President Biden. and under Vice President Kamala Harris. But we know that now almost all of our vaccines have been now had enough research. It's been a while. It's been, I think, since, well, so they started giving it in December of 20 to the first cohorts, and the experimental groups were before that. But they've decided that the 3 that they are approving at this point in the US, it just means those are the 3 that we have FDA research on. I don't want you to think that because your country may use a different vaccine, that it's a bad vaccine. It's probably just because it was produced in another country, and the US probably wants to use stuff that's produced here. That's my bias, but I do believe it's true. But so the vaccinations that we are allowed to give here in the United States, you know, myself as a nurse and my students, are only the Moderna, the Johnson & Johnson, and the Pfizer. And is there a vaccine development for neonates? I haven't heard anything about neonates yet, but I'm also not looking at the scientific literature on vaccine development. If my son was here beside me, he's a pharmacist and reads this material all the time. Unfortunately, he's not out of work yet tonight. This is my night. This is my 11 o'clock at night for me.
Yeah.
Sorry for that. But I don't know the answer to, is there vaccine development for neonates, but that's an important thing for the future. But I do know that in the US, we now have approval for age 5 years old and up, but we've only given it so far to 12 years old and up. But I've mentioned during my my earlier answer that Chile is using it across all children, but I wouldn't say neonates though. Is that what you were asking about?
I think so. Okay, there's another, Dr. Dayan, from Ade, Nurmayanti. Yeah, good morning, Dr. Dayan. I want to ask you, in USA, what is used as vaccine for medical person? How effective, what is the effectivity rate of the vaccine?
Thank you for your question. I love these questions. Medical personnel are allowed to take any of the 3 vaccines. Some people will choose the 3rd one, Johnson & Johnson, the last one to be developed, because you only need 1 vaccine to be considered protected against COVID-19. The other 2 vaccines, Moderna and Pfizer, require 2 shots. Pfizer, you need a 3-week time period between the first and second. Moderna, you need a 4-week time period between the first and second. What I've understood from my consultation with the physician at the Department of Health here in Rhode Island is that when someone asks me now which one should they get as a booster, they're recommending Moderna because it seems to be better for the Delta variant. That is not something I know from reading scientific literature. That was from hearsay working at that event for these last several weeks. What's the efficacy rate? Right now, they're saying in their most recent research, and this is the vaccine team with the Federal Drug Administration, that people that are not immunocompromised or under age 65 do not need a booster. So they're saying that they're still effective. And most people got the first vaccine and second vaccine somewhere between February, March, April, May. Those were the first groups of people that received the vaccine. We also know that for those who have the vaccine, you still can get an infection. You can still be positive for COVID. But what we've seen is that those that had the vaccine are much less likely to get severe illness and less likely to be hospitalized. Those without the vaccine in the country are those that seem to be in all of our intensive care unit beds for COVID-19 right now.
Okay, thank you very much. There is also, somebody's raising her hand, Rosa Ulfa. Okay, You may unmute now. Ms. Rosa. You may ask your question now. Hello.
Is that you, Rosa?
Excuse me, Dr. Diane and Dr. Catherine. There are two
Yes.
questions still left on the chat room in
Okay.
English.
Yes.
Let me go
It
ahead.
says here, what vaccine are recognized by your country? Oh, by your country?
Only the three, the Pfizer, the Moderna, and the Johnson and Johnson.
Johnson and Johnson. Okay, there's another one here from Ami, Armini. Nice to meet you, Dr. Dayan. I am Wayan from Bali. That's how many vaccinations are recommended to get optimal immunity, doctor?
Well, anyway, Ami, I have to tell you that on one of my trips to Indonesia, I had the opportunity to also go to Bali, also another beautiful part of Indonesia. It's a great area. So, how many vaccinations are recommended to get optimal immunity? I don't know. We are only recommending the 2 doses of Pfizer, the 2 doses of Moderna, part 1, part 2 of both, and 1 dose of Pfizer of the Johnson and Johnson. Optimal immunity, I think we're still trying to figure out how long it will last for. And the only thing we know right now by the vaccine task force with the Federal Drug Administration is that they have decided that as of right now, everyone in the country who's had the maximum dose of either 2 Modernas, 2 Pfizers, or 1 Johnson and Johnson is good right now. They're not seeing any kind of significant decline where a person would get COVID, not only that you're going to get the COVID infection, but they're not seeing it where they would get severe illness with it or hospitalized. So they are only recommending it for those 2 cohorts. I would say the only other thing is that they have to keep practicing in those studies. They're trying to get more and more people in their studies to follow them over time to see how long that kind of immunity will last. I'm not sure that they know yet, but I'm also answering you. I'm a public health nurse. I'm not a vaccine scientist. So I'm answering you based on when I'm reading in journal reports or in at the Johns Hopkins site.
Okay, that answers your question, Ms. Ami. Okay, so we have another one here, Dr. Dayan. Hello, from Ida Mardalena. Hello, Mrs. Dayan. Nice to meet you. I would like to ask about the post-COVID infection patient. How long they must be waiting for safety vaccine? Thank you very much. How long will they wait?
I'm wondering, Ida, do you mean the people that keep feeling sick from COVID? Like you're talking about the people that are home now, they're not in the hospital, but they still maybe have trouble breathing or they still have no taste or smell. That are you talking about that kind of post-COVID infection? even if a person has COVID, I can just tell you this, in the United States, a very good friend of mine who had immigrated here from Mexico as a child, she developed COVID over last December. She was hospitalized. She was in an intensive care unit, and she had post-COVID symptoms, those symptoms that last over a period of time. And she had hers for 5 to 6 months, where it was difficult for her to think and go to work and those kinds of things. But they still allowed her, not only did she get the monoclonal antibodies at the time, but they still allowed her to get her vaccines when she came home from the hospital. Does that answer your question, Ida? And then someone else named Try asked me if I know about a vaccine called Nusantara. I do not know anything about Nusantara. I do know that in the United States, the FDA is very, very particular
Mr.
about what they approve. And I know that during the AIDS epidemic, that some of our best medications that were less expensive were coming out of other countries. You know, we found out from former President Clinton ran a organization called the Clinton Foundation, or Clinton AIDS Foundation, and he sponsored, his organization, his nonprofit, sponsored the production and the dissemination of AIDS medications around the world at a cheaper level, at a less expensive level than what our pharmaceutical industries in the United States were doing. So I believe that there are good drugs produced in many countries. You just, as long as your particular country has looked at it and knows about the safety and the efficacy, I think what's important is that it's getting to the people. And I do know that Chile has had a very successful reduction in COVID infection and illness, and they do not use the same vaccines as the United States. But I'd have to find out which vaccine it is. I'd have to look it up.
Excuse me, Dr. Tien. Dr. Catherine is now having electric problem, so let me accompany you now. So
Thank
this will be probably the last question from Mr. Alan. Mr. Alan, do you hear with us?
Yes. Hi, good morning, Doctor.
Good morning.
Hi, I'm a faculty member of St. Paul University, Philippines, College of Nursing. I would just like to ask, there have been reports that there are excess doses of vaccines in first world countries. To what extent should they donate to third world countries who are craving for the need for the first dose of vaccine? And personally, I have seen posts of my friends working in other countries that they are already getting booster vaccines, booster shots, while other countries are still craving for their first doses. What can you say about this? Thank you.
I say that unfortunately we have an unethical, unjust global system where obviously the countries that have the higher income countries, or what's referred to by Wallerstein as first world countries, take care of themselves first. Often. I do believe, from listening to our current president, Biden, that he is trying to move on getting vaccines that we have into other countries. It would be, I think you're absolutely right. Here we have in our country, we're giving boosters to immunosuppressed and over 65. And there are people in other parts of the world that don't even have one dose. And I think it's our responsibility as humans to care for the global community and not to stay focused on self. I do think that we have that responsibility as a country that has more material goods to share what we do have with others. I do think that at the moment, we currently have a leader in the United States. Our president is much more globally conscious than a former president. And I do think that he will have a staff that will hopefully encourage him to go in the direction of dissemination of what products that we do have that we can share. And I think that's one of the reasons for the decision with the FDA subcommittee saying we can't be going out giving boosters. There are people that haven't even had their first dose. And that's why I can't say why they made their decision because you never know why, but I hope it had something to do with the fact that we already have our first shots and let other people at least have one. I'm not sure if that answers your question, but yes, things are unfair and unjust, and I do think we have that responsibility as nurses to say what's fair, what's right, and maybe get the International Council of Nursing to get involved in it to help lead us to work with not only the World Health Organization, but with countries that do have the resources to get them to share it and share responsibly.
Well, thank you.
So I think that was supposed to be the last question.
Well, thank you very much, Dr. Dian. There is still a lot of question in the text box, but we're really sorry that we aren't able to give some response for that questions because of the time limit that we have. So, Dr.
Sorry.
Catherine. Hello, Dr. Catherine.
Sorry, there was a power interruption here in our place. Yes.
Yeah. Okay.
I can just see one right now where it says about pregnant women. Yes, pregnant women can get the vaccine. And there was a period of time where some pregnant women were worried about it, but they do get it.
Yeah, that's right.
Yeah.
Okay, so that's it.
Well, Dr. Catherine, we
I
have
think no more
to
questions, doctor.
Close today's session because we have to continue our agenda today. So,
Yes.
okay, Dr. Catherine, the time is yours.
Yeah. Thank you, Dr. Dian, for sharing us your insightful presentation. It was indeed we are indeed very grateful to have you here in the conference. Thank you very much. Again, thank you very much, Dr. Dian.
Very thankful for all of you. Thank you for all you do.
FDC is a dental clinic that combines a unique concept, comfort, friendliness, and technological sophistication. FDC Dental Clinic exists as a solution to the unaffordable dental services and people's terrifying stigma of going to the dentist. FDC Dental Clinic already has 15 branches spread across DKI Jakarta, Bogor, Depok, Tangerang, Bekasi, Bandung, Surabaya, Yogyakarta, and will expand throughout Indonesia. Our vision is to become one of the best dental clinic with good service and to put a smile on our beloved patients. Therefore, we have 7 missions. We develop a competent team by creating excellent quality and standardized services. We also provide every aspect of our service professionally. We provide integrated health services oriented to patient and family needs. We prioritize teamwork on patients' satisfaction and safety-oriented. We provide a clean and hygienic work environment. We serve the best solution for patient through the great quality services and affordable prices. We develop a friendly and caring team who treats patients as family. We have 4 company values: integrity, quality, learn and growth, grateful and abundant. To build a happy team, we also have some fun events, like outing or gathering, themed costumes, CSR programs, and National Day events. To develop team skills, we have training programs, both for soft skills or hard skills. This is our clinic. And now, it's time for you to join us.
Thank you very much, Dr. Catherine, for guiding us to a wonder session with Dr. Bien from University of Rhode Island, USA.
Ladies and gentlemen, since it's already 10:30 a.m., we kindly remind you that the second session will be begin in few minutes. The second session will be divided into 4 breakout rooms, with the topic of in room 1 is from Dr. Niluh Putu Eka Sudiwati from Health Polytechnic of Health Ministry Malang.
And the room 2 is Mrs. Jackie S. Robles from International Federation of Nurse Anesthesis USA on the role of nurse anesthesis in universal health.
And the room 3 is from Professor Armah Binti Tengah from Polytechnic of Brunei on the challenge to nursing education during pandemic, Brunei Darussalam perspective.
And the room 4 is Mr. Niko Tasni Saputro MPH from Health Polytechnic Ministry of Health Yogyakarta on medical record borrowing control tools design, tracer, and outguide.
We kindly remind you that you have to join to the breakout room by yourself. If you are wondering how to enter the room, you can join by clicking the breakout room button on the bottom side of your Zoom meeting.
Baik, kami ingatkan sekali lagi untuk para peserta untuk join kepada breakout room yang telah disediakan dengan cara klik tombol join breakout room di layar Zoom meeting peserta sekalian. Terima kasih.
Baik, Bapak dan Ibu, breakout room sudah kami buka. Silahkan bagi Bapak dan Ibu untuk memilih topik sesuai dengan keinginan Bapak dan Ibu masing-masing dengan cara mengeklik tombol breakout room di layar Zoom masing-masing. Terima kasih.
Bu Bella, kamu kan udah tahu di masa pandemi gini tuh jangan bayar pakai cash. Mau bayar pakai cash nanti lagi di sini virus kabeh. Hari gini tuh pakai tuh BNI mobile banking. Ki lho tak jari mlebu wis ngetik pin to ora aku iki gur nganggo face recognition, rasa copot masker. Oh jelas, HP ini mantep deh. Oke, Prof Piku sini anaknya. Ya kan, anakku anak.
Oh, bisa pasang foto juga.
Oh
ya?
jelas, BNI mobile banking. Terus lain barang gue QR code. Wih, kayak Mas Cingok saudaranya tuh Oh, garis di scan. Oh, mantep toh. Wes iki jenenge mantep BNI mobile banking. Wes tak bayar iki nggo tipe.
Terima kasih.
Oh tak kasbon ke ya.
Thank you ya, Pak.
Bojomu kan kerja ora aku. Assalamualaikum. Bella, gimana Bel?
Pak, sekarang udah pakai digital bank loh.
Yang baru itu?
Iya, yang lagi happening itu.
Yang katanya satu akun bisa 2 rekening?
Iya.
Masuknya kamu pakai PIN atau pakai sidik jari?
Yang biasanya itu, Pak.
BNI Mobile Banking sudah pakai face recognition.
Buat ngerencanain liburan itu kan?
BNI Mobile Banking juga bisa. Live Goal namanya. Udah gitu tarik tunainya tanpa perlu kartu. Kita kalau bayar-bayar tinggal pakai QR code. Gak ribet. Rekeningnya banyak. BNI juga bisa. BNI Mobile Banking, BNI-nya sendiri udah 75 tahun melayani Indonesia. Percaya tuh sama yang pasti-pasti, apalagi mengolah uang. Udah pakai BNI Mobile Banking aja.
Udahlah, aku download mobile bankingnya BNI.
Ya, karena kamu pakai BNI Mobile Banking, yang kali ini tak bayari aja. Wah, tas dulu dong.
Iya.
Pandemi ya, gas langsung gas.
Adik Anda sudah saya selamatkan. Nggak punya. Kalau begitu bikin deh. Bang jauh. Terus? Udah malam. So, takut.
Hari gini nggak ada alasan lagi buat rempong bikin rekening tabungan. Download dan buka aplikasi BNI Mobile Banking. Klik daftar. Baca syarat dan ketentuan. Lengkapi data diri, lalu klik selanjutnya. Lakukan selfie, ikuti ekspresi wajah yang diminta, netral, senyum, kaget, buka tabungan BNI dan tingkatkan transaksi di BNI Mobile Banking nggak pakai nanti.
Bu Bella, kamu kan udah tahu di masa pandemi gini tuh jangan bayar pakai cash. Bayar pakai cash nanti lagi di sini.
Cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru.
Bisa, kan pakai Kris. Jadi mudah.
Mulai eksplorasi cara tarik tunai baru.
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
Mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Galah! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live goals, kirim digital kado,
bayar tagihan rutin, top up e-wallet,
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Taplus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktifasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
mulai bisa apa aja sekarang.
Cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru.
Bisa, kan pakai Kris. Jadi mudah.
Mulai eksplorasi cara tarik tunai baru.
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
Mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Galah! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live goals, kirim digital kado,
bayar tagihan rutin, top up e-wallet,
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Taplus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktifasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
mulai bisa apa aja sekarang.
Cuma rebah.
Om Swastiastu, saya Direktur Politeknik Kesehatan Denpasar, ingin menyampaikan terkait dengan institusi pendidikan Politeknik Kesehatan Kemenkes Denpasar. Ya, kita adalah merupakan unit pelaksana teknis Kementerian Kesehatan di bidang pendidikan.
Politeknik Kesehatan Kementerian Kesehatan Denpasar atau biasa disebut dengan Poltekkes Kemenkes Denpasar adalah institusi pendidikan tinggi kesehatan di bawah Badan Pengembangan dan Pemberdayaan Sumber Daya Manusia Kesehatan Kementerian Kesehatan Republik Indonesia yang menyelenggarakan program pendidikan Diploma 3, Sarjana Terapan, dan program profesi. Poltekkes Kemenkes Denpasar merupakan institusi pendidikan yang didirikan atas dasar Surat Keputusan Menteri Kesehatan Republik Indonesia tanggal 16 April tahun 2001. Poltekkes Kemenkes Denpasar memiliki 6 jurusan dan 11 program studi, di antaranya jurusan keperawatan dengan program studi Diploma 3, Sarjana Terapan, dan profesi nurse. Memiliki unggulan kegawat daruratan dalam penanganan bencana, menghasilkan lulusan yang mampu berkomunikasi dalam bahasa asing, serta mampu menangani pasien gawat darurat dengan teknologi dan fasilitas modern. Jurusan kebidanan dengan program studi Diploma 3, Sarjana Terapan Kebidanan, dan profesi bidan, memiliki keunggulan asuhan kebidanan komplementer yang berorientasi pada budaya dan konsep Trihita Karana. Memiliki fasilitas perkuliahan yang representatif, dilengkapi dengan laboratorium ANC, INC, PNC, Neonatus, KB, Kespro, keterampilan dasar kebidanan, kegawat daruratan obstetri dan neonatus, komunitas, dan komplementer. Jurusan Kesehatan Gigi dengan program studi Diploma 3 memiliki keunggulan Dental Health Tourism, didukung fasilitas ruang kelas yang memadai, laboratorium yang representatif meliputi laboratorium preklinik, promotif preventif, kuratif, serta sarana pendukung seperti internet, perpustakaan, dan auditorium. Jurusan Gizi dengan program studi Diploma 3 dan Sarjana Terapan Gizi dan Dietetika, memiliki keunggulan mengembangkan pendidikan ke arah dietetik for tourism, mampu bersaing dalam skala nasional maupun internasional, didukung dengan fasilitas ruang kuliah yang memadai serta laboratorium yang representatif meliputi laboratorium biomedik, antropometri, pendidikan dan konsultasi gizi, analisis zat gizi, pengolahan pangan, dietetik kuliner, serta organoleptik, unggulan tanah, makanan dan minuman, serta menganalisa dampak kesehatan lingkungan, didukung dengan fasilitas ruang kelas yang memadai, serta laboratorium yang representatif meliputi laboratorium kimia, entomologi, fisika, mikrobiologi, komputer, bengkel kerja, serta ditunjang dengan fasilitas lain seperti perpustakaan, sarana olahraga, dan internet. Jurusan Teknologi Laboratorium Medis dengan program studi Diploma 3 dan Sarjana Terapan memiliki keunggulan Tourism Medical Laboratory, didukung oleh fasilitas ruang kelas yang memadai serta laboratorium yang representatif meliputi laboratorium kimia, patologi klinik, parasitologi, mikrobiologi, dan mikologi. Poltekkes Kemenkes Denpasar menjadi institusi pendidikan yang unggul dengan beragam prestasi baik di tingkat lokal maupun nasional. Di antaranya penghargaan sebagai institusi dengan kerjasama internasional terbaik, dosen berprestasi tingkat nasional, pranatal laboratorium pendidikan terbaik, arsiparis terbaik, serta mahasiswa berprestasi tingkat nasional.
Untuk menunjang aktivitas pendidikan, penelitian, dan pengabdian masyarakat, Poltekkes Kemenkes Denpasar telah dilengkapi fasilitas terbaru seperti berikut. Auditorium yang terletak di Direktorat dan Kampus Pulomoyo, ruang kelas yang memadai, laboratorium terpadu, mini hospital, perpustakaan terpadu, kendaraan operasional, serta lahan praktek yang sesuai dengan tujuan mata kuliah di mitra kerja Poltekkes, rumah sakit, puskesmas, industri yang relevan. Untuk mengembangkan kreativitas dan meningkatkan prestasi mahasiswa, Poltekkes Kemenkes Denpasar menyelenggarakan beberapa unit kegiatan mahasiswa, yaitu PIKM, KSR, Mapala. Kegiatan ilmiah, tari, UKM Tabuh, paduan suara, English Club, kewirausahaan, pramuka, voli, basket.
Bagi adik-adik yang ingin bekerja di luar negeri pada sektor kesehatan, ditunggu kehadirannya di Poltekkes Kemenkes Denpasar. Raih suksesmu bersama kami.
Banjarmasin Polytechnic of Health is the one of the 38 health polytechnic in Indonesia, which is located in the heart of Banjarbaru city. Banjarmasin Polytechnic of Health is an educational institution for health professionals. It aims to procure skilled, capable, professional, and qualified health working in order to support the health service nationwide or even international.
Health Polytechnic Ministry of Health Banjarmasin has a vision as a center for moral, professional, and excellent health education. And the mission are: first, conducting moral, professional, and excellent health education. Second, conducting excellent research and training to improve the quality of health education. Third, conducting community service in the health sector based on science, research, and oriented to community needs. Fourth, building an academic community based on organizational culture. First, strengthening a professional and accountable education system. Six, building cross-collaborating network program and sector, both national and international.
Banjarmasin Polytechnic of Health has 6 majors. They are environmental health, midwifery, nutrition. Health analysis. Nursing. Dental care. In order to ensure the consistent development of academic quality, Banjarmasin Polytechnic of Health strives to keep on improving the quality of teaching and learning process as well as education management, which is in accordance with the safe education standard. To guarantee the implementation of higher quality education, Banjarmasin Polytechnic of Health have already made an effort to gain the trust from the Ministry of Health to bear the predicate B for higher education, accreditation and predicate A and B for each department, as well as management certification of ASO 90001 208 up until now. Banjarmasin Polytechnic of Health has integrated library facilities which provides a variety of collections such as module, teaching book or resources, scientific magazine, e-book, repository, accredited national journal, international journal, thesis, and student scientific paper to reinforce the process of education, research, and service to society. To hone Polytechnic students' skill and talent, we also provide them with extracurricular activities, namely pencak silat, volleyball, basketball, futsal, band, vertical rescue, English club, scout, and many others.
Poltekkes Banjarmasin.
Moral, profesional, excellent.
Adalah Akademi Keperawatan GKY, sebuah lembaga pendidikan bidang keperawatan yang berdiri sejak tahun 1995 menjawab tantangan di bidang tenaga kesehatan, terutama tenaga perawat vokasi yang profesional. Yayasan Keperawatan Yogyakarta Akper YKY merupakan akademi keperawatan swasta milik Yayasan Keperawatan Yogyakarta yang menyelenggarakan pendidikan program Diploma 3 Keperawatan untuk menghasilkan lulusan perawat vokasi yang profesional dan bermutu tinggi. Akreditasi institusi BAN PT nomor 293 tahun 2015 dan terakreditasi program studi B oleh Lembaga Akreditasi Mandiri Perguruan Tinggi Kesehatan tahun 2017.
Visi Akademi Keperawatan YKY Yogyakarta menjadi institusi pendidikan keperawatan yang menghasilkan profesi perawat yang berwawasan global, berkarakter, dan unggul di tatanan pelayanan keperawatan di tahun 2035.
Akper YKY Yogyakarta memiliki misi institusi 1. Menyelenggarakan pendidikan keperawatan berkualitas dan berwawasan global. 2. Melaksanakan penelitian dan pengabdian kepada masyarakat yang unggul berdasarkan iptek keperawatan, kesehatan, dan berlandaskan kearifan lokal. 3. Mengembangkan manajemen institusi dengan tata kelola yang baik atau good academic governance dan sumber daya profesional berdasarkan iptek. 4. Mengembangkan pembinaan karakter pada sivitas akademika. Dan 5. Menjalin kerjasama dengan kemitraan baik dalam maupun luar negeri untuk melaksanakan Tridharma perguruan tinggi. Penyelenggaraan pendidikan di Akper YKY Yogyakarta menggunakan kurikulum pendidikan Diploma 3 Keperawatan Akper YKY Yogyakarta tahun 2014. Berpedoman pada kurikulum berbasis Kerangka Kualifikasi Nasional Indonesia atau KKNI Program Diploma 3 Keperawatan tahun 2014. Berlandaskan visi, misi dari pendidikan Diploma 3 Keperawatan, falsafah keperawatan yang mencakup konsep manusia, kesehatan, lingkungan, dan keperawatan, serta berorientasi pada kaidah-kaidah pendidikan tinggi nasional.
Keunggulan Akper YKY Yogyakarta yaitu di keperawatan keluarga. Hal ini karena salah satu aspek penting dalam keperawatan adalah keluarga.
Untuk menjadi seorang perawat vokasi yang profesional, mahasiswa Akper YKY Yogyakarta harus menempuh studi selama 6 semester dengan batas maksimal 10 semester dan menyelesaikan 120 SKS. Pada setiap semester, mahasiswa wajib menyelesaikan beban studi yang telah ditentukan dalam bentuk kuliah, diskusi, responsi, tutorial, seminar, praktek di laboratorium, dan praktek klinik atau lapangan, serta bentuk lain yang sesuai. Akper YKY memiliki fasilitas berupa gedung yang representatif dengan ruang kuliah ber-AC yang nyaman serta staf pengajar yang berpengalaman. Selain itu, Akper YKY memiliki perpustakaan dengan koleksi buku umum dan bidang keperawatan serta pustaka digital yang menunjang perkuliahan mahasiswa. Fasilitas penunjang lain yang terpenting adalah laboratorium keperawatan, meliputi laboratorium keperawatan anak, maternitas, keperawatan gawat darurat dan manajemen bencana, keperawatan dasar, keperawatan jiwa, dan keperawatan medikal bedah dengan peralatan dan perlengkapan yang sesuai standar medis yang telah ditentukan. Dibimbing oleh staf yang mumpuni, diharapkan mampu mencetak tenaga perawat yang handal dan berdedikasi. Menjawab tantangan global, lulusan Akper YKY Yogyakarta tidak hanya dituntut menguasai ilmu keperawatan saja, tetapi juga mampu berbahasa asing yang baik. Oleh sebab itu, Akper YKY memiliki laboratorium bahasa sebagai penunjang perkuliahan. Didukung pula dengan laboratorium komputer yang sesuai dengan kebutuhan bidang medis. Akbar YKY Yogyakarta juga memiliki Gria Sehat, sebuah tempat praktik yang menjalankan praktek asuhan keperawatan yang dilaksanakan oleh tenaga pengajar yang memiliki kompetensi melaksanakan praktik keperawatan. Gria Sehat melayani perawatan luka, konsultasi kesehatan, baby spa, pijat bayi, terapi holistik, dan pemeriksaan darah. Untuk meningkatkan kualitas pendidikan mahasiswa dan lulusannya, Akbar YKY bekerja sama dengan Lincoln University.
Acara ini didukung oleh 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 Acara ini didukung oleh
Welcome to Poltekkes Kemenkes Palembang. Health Polytechnic of the Ministry of Health Palembang, better known as the Poltekkes Kemenkes Palembang, is one of the higher educational institutions in South Sumatra. It was established in 2001 based on the decree of the Menkes Kesos RI number 298 Menkes Kesos /SK/4 2001, dated on April 16, 2001. The main office is located on Jalan Jenderal Sudirman, kilometer 3.5, number 13 and 65, Muhammad Hussein Hospital Complex, Palembang.
The vision of Poltekkes Kemenkes Palembang, becoming a superior and dignified health higher education institution at the national level in 2024. To reach the vision, Poltekkes Kemenkes Palembang has formulated 3 missions, implementing qualified Tridharma perguruan tinggi on the basis of ethical and moral values following science and technology development, implementing good institutional governance through the use of the information and technology, widening mutual partnership for institutional development.
Poltekkes Kemenkes Palembang currently has 15 study programs distributed throughout South Sumatra Province, which located in Palembang, Muara Enim, Batu Raja, Lubuk Linggau, and Lahat.
All the study programs, a 3-year diploma and a 4-year diploma programs have been accredited by LAMPTKes, Lembaga Akreditasi Mandiri Perguruan Tinggi Kesehatan Indonesia. The study programs are a 3-year and a 4-year diploma program in nursing, a 3-year and a 4-year diploma program in midwifery, a 3-year diploma program in nutrition, and a 4-year diploma program in nutrition and dietetics, a 3-year diploma program in pharmacy, a 3-year and a 4-year diploma program in medical laboratory technology, a 3-year diploma program in dental health, a 3-year diploma program in sanitation.
Poltekkes Kemenkes Palembang is supported by high-speed Wi-Fi connection and also developed an AMS, Academic Management System, an application that helps lecturers and students in the learning and teaching process digitally, especially during pandemic.
Poltekkes Kemenkes Palembang has standardized computer-based test center, which can be used for the competency test and student admission. Poltekkes Kemenkes Palembang has an active role in providing health education, especially to the society of South Sumatra. To increase the capacity of teaching staff and students, Poltekkes Kemenkes Palembang continues to conduct online and offline workshops. Continuing innovation has been capable to be at the national level and has received the numerous awards. Awarding Corruption-Free Institution WBK in 2020. Awarding the Public Service Obedience Grade B in 2020. Outstanding lecturers. Outstanding students. Create professional health workers. Poltekkes Kemenkes Palembang has collaborated, continuing mutual partnerships with government, private sectors, and community agencies. Active in collaborative community services with the Commission 9 of People's Representative Board. Participate in COVID-19 vaccine program. Poltekkes Kemenkes Palembang has been successful in holding ICOS, International Conference on Health, Social Science, and Technology.
Saya ucapkan terima kasih untuk Poltekkes Kemenkes Palembang Prodi Keperawatan Tubuh Meninggal karena berkat mengenyam ilmu pendidikan di Poltekkes Kemenkes Palembang Prodi Keperawatan Meninggal, saya bisa bekerja di Jepang seperti saat ini.
Perkenalkan, saya Rido Rajanto, alumni jurusan Farmasi Poltekkes Kemenkes Palembang. Selama di bangku perkuliahan, saya mendapatkan banyak ilmu pengetahuan serta kesempatan untuk mengembangkan potensi dan relasi yang saya dapatkan. Terima kasih Poltekkes Kemenkes Palembang. Berkat Anda, saya bisa bekerja di Rumah Sakit Muhammad Hussein, Palembang.
Poltekkes Kemenkes Palembang, superior and dignified.
Cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru.
Bisa, kan pakai Kris, jadi mudah.
Mulai eksplorasi cara tarik tunai baru.
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
Mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Salah. BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live goals, kirim digital kado,
bayar tagihan rutin, top up e-wallet,
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Taplus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktivasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
mulai bisa apa aja sekarang.
Cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru.
Bisa, kan pakai Kris, jadi mudah.
Mulai eksplorasi cara tarik tunai baru.
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
Mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Salah. BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live goals, kirim digital kado,
bayar tagihan rutin, top up e-wallet,
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Taplus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktivasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
mulai bisa apa aja sekarang.
Yayasan Pendidikan Karya Adi Husada, Akademi Kesehatan Gigi Karya Adi Husada Mataram, terakreditasi BAN PT, merupakan kampus akademik jurusan kesehatan gigi satu-satunya yang ada di NTB, yang beralamat di Jalan Lingkar Selatan, Mapak Indah Mataram, sebelah selatan kantor Camat Skarbela, Lombok Barat. Visi menghasilkan lulusan tenaga ahli media kesehatan gigi yang beriman, cerdas, profesional, dan mandiri. berfungsi 1. Menyelenggarakan pendidikan yang menghasilkan lulusan yang memiliki kompetensi keilmuan, keterampilan, dan karakter di bidang kesehatan. 2. Peningkatan sumber daya manusia baik kualitas maupun kuantitas. 3. Pengembangan kurikulum. 4. Pemantapan kelembagaan dan organisasi. 5. Meningkatkan sarana dan prasarana. 6. Memperluas hubungan mitra kerja baik regional, nasional, dan internasional dalam rangka pelaksanaan Tridharma perguruan tinggi dan pemanfaatan lulusan. 7. Melaksanakan kegiatan penelitian dan pengabdian masyarakat. 8. Konsolidasi kemahasiswaan dan alumni. Akademi Kesehatan Gigi Karya Adi Husada Mataram mempunyai fasilitas 1. Gedung perkuliahan lantai 3, full ex-house fund, AC, dan audiovisual. 2. Ruang perpustakaan. 3. Ruang klinik. 4. Ruang preklinik. 5. AH Mart, gazebo, dan lapangan. 6. Wi-Fi. 7. Bus. Akademi Kesehatan Gigi Karya Adi Husada Mataram, yang dimana tenaga pengajar dosen dengan kualifikasi pendidikan 1. 5 orang dokter gigi dan spesialis. 2. 3 orang S3. 3. 10 orang S2. 4. 1 dokter umum. 5. 4 orang D3 perawat gigi. Pengurus struktural Akademi Kesehatan Gigi Karya Adi Husada Mataram, Direktur Suknawadi SKM MMKes, Wakil Direktur 1 Dr. Randus Haji Sahar MM, Wakil Direktur 2 Haji Suhardi SKM, Wakil Direktur 3 Dr. Bai Mutmainah MSI. Di bawah naungan Yayasan Pendidikan Karya Adi Husada, AKG Mataram mempunyai peluang kerja yang sangat terbuka.
Acara ini didukung oleh 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 Acara ini didukung oleh
Note session by Mr. Wikan Sakarinto, PhD, the Director General of Vocational Higher Education.
Ladies and gentlemen, we kindly remind you that we will have a break for 1 hour from 12 a.m. until 1 p.m. So please be right back at 1 p.m. to continue our next session. Bapak-bapak dan ibu-ibu sekalian, kami mengingatkan bahwa sekarang adalah waktunya untuk istirahat selama 1 jam, kemudian nanti jam 1 akan kita lanjutkan untuk sesi berikutnya. Terima kasih.
Om Swastiastu, saya Direktur Politeknik Kesehatan Denpasar, ingin menyampaikan terkait dengan institusi pendidikan Politeknik Kesehatan Kemenkes Denpasar. Ya, kita adalah merupakan unit pelaksana teknis Kementerian Kesehatan di bidang pendidikan.
Politeknik Kesehatan Kementerian Kesehatan Denpasar atau biasa disebut dengan Poltekkes Kemenkes Denpasar adalah institusi pendidikan tinggi kesehatan di bawah Badan Pengembangan dan Pemberdayaan Sumber Daya Manusia Kesehatan Kementerian Kesehatan Republik Indonesia yang menyelenggarakan program pendidikan Diploma 3, Sarjana Terapan, dan program profesi. Poltekkes Kemenkes Denpasar merupakan institusi pendidikan yang didirikan atas dasar Surat Keputusan Menteri Kesehatan Republik Indonesia tanggal 16 April tahun 2001. Poltekkes Kemenkes Denpasar memiliki 6 jurusan dan 11 program studi, di antaranya jurusan keperawatan dengan program studi Diploma 3, Sarjana Terapan, dan profesi nurse. Memiliki unggulan kegawat daruratan dalam penanganan bencana, menghasilkan lulusan yang mampu berkomunikasi dalam bahasa asing, serta mampu menangani pasien gawat darurat dengan teknologi dan fasilitas modern. Jurusan kebidanan dengan program studi Diploma 3, Sarjana Terapan Kebidanan, dan profesi bidan, memiliki keunggulan asuhan kebidanan komplementer yang berorientasi pada budaya dan konsep Trihita Karana, memiliki fasilitas perkuliahan yang representatif dilengkapi dengan laboratorium ANC, INC, PNC, Neonatus, KB, Kespro, keterampilan dasar kebidanan, kegawat daruratan obstetri dan neonatus, komunitas, dan komplementer. Jurusan Kesehatan Gigi dengan program studi Diploma 3 memiliki keunggulan Dental Health Tourism, didukung fasilitas ruang kelas yang memadai, laboratorium yang representatif meliputi laboratorium preklinik, promotif preventif, kuratif, serta sarana pendukung seperti internet, perpustakaan, dan auditorium. Jurusan Gizi dengan program studi Diploma 3 dan Sarjana Terapan Gizi dan Dietetika, memiliki keunggulan mengembangkan pendidikan ke arah dietetik for tourism, mampu bersaing dalam skala nasional maupun internasional, didukung dengan fasilitas ruang kuliah yang memadai serta laboratorium yang representatif meliputi laboratorium biomedik, antropometri, pendidikan dan konsultasi gizi, analisis zat gizi, pengolahan pangan, dietetik kuliner, serta organoleptik. Jurusan Kesehatan Lingkungan dengan program studi Diploma 3 dan Sarjana Terapan Kesehatan Lingkungan memiliki keunggulan menghasilkan lulusan yang mampu memonitoring kualitas fisik air, udara, tanah, makanan dan minuman, serta menganalisa dampak kesehatan lingkungan, didukung dengan fasilitas ruang kelas yang memadai serta laboratorium yang representatif meliputi laboratorium kimia, entomologi, fisika, mikrobiologi, komputer, bengkel kerja, serta ditunjang dengan fasilitas lain seperti perpustakaan, sarana olahraga, dan internet. Jurusan Teknologi Laboratorium Medis dengan program studi Diploma 3 dan Sarjana Terapan memiliki keunggulan Tourism Medical Laboratory, didukung oleh fasilitas ruang kelas yang memadai serta laboratorium yang representatif meliputi laboratorium kimia, patologi klinik, parasitologi, mikrobiologi, dan mikologi. Poltekkes Kemenkes Denpasar menjadi institusi pendidikan yang unggul dengan beragam prestasi baik di tingkat lokal maupun nasional. Di antaranya penghargaan sebagai institusi dengan kerjasama internasional terbaik, dosen berprestasi tingkat nasional, pranatal laboratorium pendidikan terbaik, arsiparis terbaik, serta mahasiswa berprestasi tingkat nasional.
Untuk menunjang aktivitas pendidikan, penelitian, dan pengabdian masyarakat, Poltekkes Kemenkes Denpasar telah dilengkapi fasilitas terbaru seperti berikut. Auditorium yang terletak di Direktorat dan Kampus Polomoyo, ruang kelas yang memadai, laboratorium terpadu, mini hospital. perpustakaan terpadu, kendaraan operasional, serta lahan praktek yang sesuai dengan tujuan mata kuliah di mitra kerja Poltekkes, rumah sakit, puskesmas, industri yang relevan. Untuk mengembangkan kreativitas dan meningkatkan prestasi mahasiswa, Poltekkes Kemenkes Denpasar menyelenggarakan beberapa unit kegiatan mahasiswa, yaitu PIKM, KSR, Mapala, kegiatan ilmiah, tari, UKM Tabuh, paduan suara, English Club, kewirausahaan, pramuka, voli, basket.
Bagi adik-adik yang ingin bekerja di luar negeri pada sektor kesehatan, ditunggu kehadirannya di Poltekkes Kemenkes Denpasar. Raih suksesmu bersama kami.
Banjarmasin Polytechnic of Health is the one of the 38 healthy polytechnic in Indonesia, which is located in the heart of Banjarbaru city. Banjarmasin Polytechnic of Health is an educational institution for health professionals. It aims to procure skilled, capable, professional, and qualified health working in order to support the health service nationwide or even international.
Health Polytechnic Ministry of Health Banjarmasin has a vision as a center for moral, professional, and excellent health education. And the mission are: first, conducting moral, professional, and excellent health education. Second, conducting excellent research and training to improve the quality of health education. Third, conducting community service in the health sector based on science, research, and oriented to community needs. Fourth, building an academic community based on organizational culture. First, strengthening a professional and accountable education system. Six, building cross-collaborating network program and sector, both national and international.
Banjarmasin Polytechnic of Health has 6 majors. They are environmental health, midwifery, nutrition. Health analysis. Nursing. And dental care. In order to ensure the consistent development of academic quality, Banjarmasin Polytechnic of Health strives to keep on improving the quality of teaching and learning process as well as education management, which is in accordance with the said education standard. To guarantee the implementation of higher quality education, Banjarmasin Polytechnic of Health have already made an effort to gain the trust from the Ministry of Health to bear the predicate B for higher education, accreditation and predicate A and B for each department as well as management certification of ISO 90001-208 up until now. Banjarmasin Polytechnic of Health has integrated library facilities which provides a variety of collection such as module, teaching book or resources, scientific magazine, e-book, repository, accredited national journal, international journal, thesis, and student scientific paper to reinforce the process of education, research, and service to society. To hone Polytechnic students' skill and talent, we also provide them with extracurricular activities, namely pencak silat, volleyball, basketball, futsal, band, vertical rescue, English club, scout, and many others.
Poltekkes Banjarmasin.
Moral, profesional, excellent.
Adalah Akademi Keperawatan GKY, sebuah lembaga pendidikan bidang keperawatan yang berdiri sejak tahun 1995 menjawab tantangan di bidang tenaga kesehatan, terutama tenaga perawat vokasi yang profesional. Yayasan Keperawatan Yogyakarta Akper YKY merupakan akademi keperawatan swasta milik Yayasan Keperawatan Yogyakarta yang menyelenggarakan pendidikan program Diploma 3 Keperawatan untuk menghasilkan lulusan perawat vokasi yang profesional dan bermutu tinggi. Akreditasi institusi BAN PT nomor 293 tahun 2015 dan terakreditasi program studi B oleh Lembaga Akreditasi Mandiri Perguruan Tinggi Kesehatan tahun 2017.
Visi Akademi Keperawatan YKY Yogyakarta menjadi institusi pendidikan keperawatan yang menghasilkan profesi perawat yang berwawasan global, berkarakter, dan unggul tatanan pelayanan keperawatan di tahun 2035.
Akper YKY Yogyakarta memiliki misi institusi 1. Menyelenggarakan pendidikan keperawatan berkualitas dan berwawasan global. 2. Melaksanakan penelitian dan pengabdian kepada masyarakat yang unggul berdasarkan iptek keperawatan, kesehatan, dan berlandaskan kearifan lokal. 3. Mengembangkan manajemen institusi dengan tata kelola yang baik atau good academic governance dan sumber daya profesional berdasarkan iptek. 4. Mengembangkan pembinaan karakter pada sivitas akademika. Dan 5. Menjalin kerjasama dengan kemitraan baik dalam maupun luar negeri untuk melaksanakan Tridharma perguruan tinggi. Penyelenggaraan pendidikan di Akper YKY Yogyakarta menggunakan kurikulum pendidikan Diploma 3 Keperawatan Akper YKY Yogyakarta tahun 2014. Berpedoman pada kurikulum berbasis kerangka kualifikasi nasional Indonesia atau KKNI Program Diploma 3 Keperawatan tahun 2014. Berlandaskan visi, misi dari pendidikan Diploma 3 Keperawatan, falsafah keperawatan yang mencakup konsep manusia, kesehatan, lingkungan, dan keperawatan, serta berorientasi pada kaidah-kaidah pendidikan tinggi nasional.
Keunggulan Akper YKY Yogyakarta yaitu di keperawatan keluarga. Hal ini karena salah satu aspek penting dalam keperawatan adalah keluarga.
Untuk menjadi seorang perawat vokasi yang profesional, mahasiswa Akper YKY Yogyakarta harus menempuh studi selama 6 semester dengan batas maksimal 10 semester dan menyelesaikan 120 SKS. Pada setiap semester, mahasiswa wajib menyelesaikan beban studi yang telah ditentukan dalam bentuk kuliah, diskusi, responsi, tutorial, seminar, praktek di laboratorium, dan praktek klinik atau lapangan, serta bentuk lain yang sesuai. Akper YKY memiliki fasilitas berupa gedung yang representatif dengan ruang kuliah ber-AC yang nyaman serta staf pengajar yang berpengalaman. Selain itu, Akper YKY memiliki perpustakaan dengan koleksi buku umum dan bidang keperawatan serta pustaka digital yang menunjang perkuliahan mahasiswa. Fasilitas penunjang lain yang terpenting adalah laboratorium keperawatan, meliputi laboratorium keperawatan anak, maternitas, keperawatan gawat darurat dan manajemen bencana, keperawatan dasar, keperawatan jiwa, dan keperawatan medikal bedah dengan peralatan dan perlengkapan yang sesuai standar medis yang telah ditentukan. Dibimbing oleh staf yang mumpuni, diharapkan mampu mencetak tenaga perawat yang handal dan berdedikasi. Menjawab tantangan global, lulusan Akper YKY Yogyakarta tidak hanya dituntut menguasai ilmu keperawatan saja, tetapi juga mampu berbahasa asing yang baik. Oleh sebab itu, Akper YKY memiliki laboratorium bahasa sebagai penunjang perkuliahan. Didukung pula dengan laboratorium komputer yang sesuai dengan kebutuhan bidang medis. Akbar YKY Yogyakarta juga memiliki Gria Sehat, sebuah tempat praktik yang menjalankan praktik asuhan keperawatan yang dilaksanakan oleh tenaga pengajar yang memiliki kompetensi melaksanakan praktik keperawatan. Gria Sehat melayani perawatan luka, konsultasi kesehatan, baby spa, pijat bayi, terapi holistik, dan pemeriksaan darah. Untuk meningkatkan kualitas pendidikan mahasiswa dan lulusannya, Akbar YKY bekerja sama dengan Lincoln University.
Om Swastiastu, saya Direktur Politeknik Kesehatan Denpasar ingin menyampaikan terkait dengan institusi pendidikan Politeknik Kesehatan Kemenkes Denpasar. Ya, kita adalah merupakan unit pelaksana teknis Kementerian Kesehatan di bidang pendidikan.
Politeknik Kesehatan Kementerian Kesehatan Denpasar atau biasa disebut dengan Poltekkes Kemenkes Denpasar adalah institusi pendidikan tinggi kesehatan di bawah Badan Pengembangan dan Pemberdayaan Sumber Daya Manusia Kesehatan Kementerian Kesehatan Republik Indonesia yang menyelenggarakan program pendidikan Diploma 3, Sarjana Terapan, dan program profesi. Poltekkes Kemenkes Denpasar merupakan institusi pendidikan yang didirikan atas dasar Surat Keputusan Menteri Kesehatan Republik Indonesia tanggal 16 April tahun 2001. Poltekkes Kemenkes Denpasar memiliki 6 jurusan dan 11 program studi, di antaranya jurusan keperawatan dengan program studi Diploma 3, Sarjana Terapan, dan profesi nurse. Memiliki unggulan kegawat daruratan dalam penanganan bencana, menghasilkan lulusan yang mampu berkomunikasi dalam bahasa asing, serta mampu menangani pasien gawat darurat dengan teknologi dan fasilitas modern. Jurusan kebidanan dengan program studi Diploma 3, Sarjana Terapan Kebidanan, dan profesi bidan, memiliki keunggulan asuhan kebidanan komplementer yang berorientasi pada budaya dan konsep Trihita Karana, memiliki fasilitas perkuliahan yang representatif, dilengkapi dengan laboratorium ANC, INC, PNC, Neonatus, KB, Kespro, keterampilan dasar kebidanan, kegawat daruratan obstetri dan neonatus, komunitas, dan komplementer. Jurusan Kesehatan Gigi dengan program studi Diploma 3 memiliki keunggulan Dental Health Tourism, didukung fasilitas ruang kelas yang memadai, laboratorium yang representatif meliputi laboratorium preklinik, promotif preventif, kuratif, serta sarana pendukung seperti internet, perpustakaan, dan auditorium. Jurusan Gizi dengan program studi Diploma 3 dan Sarjana Terapan Gizi dan Dietetika, memiliki keunggulan mengembangkan pendidikan ke arah dietetik for tourism, mampu bersaing dalam skala nasional maupun internasional, didukung dengan fasilitas ruang kuliah yang memadai serta laboratorium yang representatif meliputi laboratorium biomedik, antropometri, pendidikan dan konsultasi gizi, analisis zat gizi, pengolahan pangan, dietetik kuliner, serta organoleptik. Jurusan Kesehatan Lingkungan dengan program studi Diploma 3 dan Sarjana Terapan Kesehatan Lingkungan memiliki keunggulan menghasilkan lulusan yang mampu memonitoring kualitas fisik air, udara, tanah, makanan dan minuman, serta menganalisa dampak kesehatan lingkungan, didukung dengan fasilitas ruang kelas yang memadai serta laboratorium yang representatif meliputi laboratorium kimia, entomologi, fisika, mikrobiologi, komputer, bengkel kerja, serta ditunjang dengan fasilitas lain seperti perpustakaan, sarana olahraga, dan internet. Jurusan Teknologi Laboratorium Medis dengan program studi Diploma 3 dan Sarjana Terapan memiliki keunggulan Tourism Medical Laboratory, didukung oleh fasilitas ruang kelas yang memadai serta laboratorium yang representatif meliputi laboratorium kimia, patologi klinik, parasitologi, mikrobiologi, dan mikologi. Poltekkes Kemenkes Denpasar menjadi institusi pendidikan yang unggul dengan beragam prestasi baik di tingkat lokal maupun nasional. Di antaranya penghargaan sebagai institusi dengan kerjasama internasional terbaik, dosen berprestasi tingkat nasional, pranatal laboratorium pendidikan terbaik, arsiparis terbaik, serta mahasiswa berprestasi tingkat nasional.
Untuk menunjang aktivitas pendidikan, penelitian, dan pengabdian masyarakat, Poltekkes Kemenkes Denpasar telah dilengkapi fasilitas terbaru seperti berikut. Auditorium yang terletak di Direktorat dan Kampus Polomoyo, ruang kelas yang memadai, laboratorium terpadu, mini hospital, perpustakaan terpadu, kendaraan operasional, serta lahan praktek yang sesuai dengan tujuan mata kuliah di mitra kerja Poltekkes, rumah sakit, puskesmas, industri yang relevan. Untuk mengembangkan kreativitas dan meningkatkan prestasi mahasiswa, Poltekkes Kemenkes Denpasar menyelenggarakan beberapa unit kegiatan mahasiswa, yaitu PIKM, KSR, Mapala, kegiatan ilmiah, tari, UKM Tabuh, paduan suara, English Club, kewirausahaan, pramuka, voli, basket.
Bagi adik-adik yang ingin bekerja di luar negeri pada sektor kesehatan, ditunggu kehadirannya di Poltekkes Kemenkes Denpasar. Raih suksesmu bersama kami.
Banjarmasin Polytechnic of Health is the one of the 38 healthy polytechnic in Indonesia, which is located in the heart of Banjarbaru city. Banjarmasin Polytechnic of Health is an educational institution for health professionals. It aims to procure skilled, capable, professional, and qualified health working in order to support the health service nationwide or even international.
Head Polytechnic Ministry of Health Banjarmasin has a vision as a center for moral, professional, and excellent health education. And the mission are: first, conducting moral, professional, and excellent health education. Second, conducting excellent research and training to improve the quality of health education. Third, conducting community service in the health sector based on science, research, and oriented to community needs. Fourth, building an academic community based on organizational culture. First, strengthening a professional and accountable education system. 6. Building cross-collaborating network program and sector, both national and international.
Banjarmasin Polytechnic of Health has 6 majors. They are environmental health, midwifery, nutrition, health analysis, nursing, and dental care, In order to ensure the consistent development of academic quality, Banjarmasin Polytechnic of Health strives to keep on improving the quality of teaching and learning process as well as education management, which is in accordance with the safe education standard. To guarantee the implementation of higher quality education, Banjarmasin Polytechnic of Health have already made an effort to gain the trust from the Ministry of Health to bear the predicate B for higher education, accreditation and predicate A and B for each department, as well as management certification of ISO 90001-208 up until now. Banjarmasin Polytechnic of Health has integrated library facilities which provides a variety of collection such as module, teaching book or resources, scientific magazine, e-book, repository, accredited national journal, international journal, thesis, and student scientific paper to reinforce the process of education, research, and service to society. To hone Polytechnic students' skill and talent, we also provide them with extracurricular activities, namely pencak silat, volleyball, basketball, futsal, band, vertical rescue, English club, scout, and many others.
Poltekkes Banjarmasin.
Moral, profesional, excellent.
Adalah Akademi Keperawatan GKY, sebuah lembaga pendidikan bidang keperawatan yang berdiri sejak tahun 1995, menjawab tantangan di bidang tenaga kesehatan, terutama tenaga perawat vokasi yang profesional. Yayasan Keperawatan Yogyakarta Akper YKY merupakan akademi keperawatan swasta milik Yayasan Keperawatan Yogyakarta yang menyelenggarakan pendidikan program Diploma 3 Keperawatan untuk menghasilkan lulusan perawat vokasi yang profesional dan bermutu tinggi. Akreditasi institusi BAN PT nomor 293 tahun 2015 dan terakreditasi program studi B oleh Lembaga Akreditasi Mandiri Perguruan Tinggi Kesehatan tahun 2017.
Visi Akademi Keperawatan GKY Yogyakarta menjadi institusi pendidikan keperawatan yang menghasilkan profesi perawat yang berwawasan global, berkarakter, dan unggul tatanan pelayanan keperawatan di tahun 2035.
Akper YKY Yogyakarta memiliki misi institusi: 1. Menyelenggarakan pendidikan keperawatan berkualitas dan berwawasan global. 2. Melaksanakan penelitian dan pengabdian kepada masyarakat yang unggul berdasarkan iptek keperawatan, kesehatan, dan berlandaskan kearifan lokal. 3. Mengembangkan manajemen institusi dengan tata kelola yang baik atau good academic governance dan sumber daya profesional berdasarkan iptek. 4. Mengembangkan pembinaan karakter pada sivitas akademika. Dan 5. Menjalin kerjasama dengan kemitraan baik dalam maupun luar negeri untuk melaksanakan Tridharma perguruan tinggi. Penyelenggaraan pendidikan di Akper YKY Yogyakarta menggunakan kurikulum pendidikan Diploma 3 Keperawatan Akper YKY Yogyakarta tahun 2014. Berpedoman pada kurikulum berbasis kerangka kualifikasi nasional Indonesia atau KKNI Program Diploma 3 Keperawatan tahun 2014. Berlandaskan visi, misi dari pendidikan Diploma 3 Keperawatan, falsafah keperawatan yang mencakup konsep manusia, kesehatan, lingkungan, dan keperawatan, serta berorientasi pada kaidah-kaidah pendidikan tinggi nasional.
Keunggulan Akper YKY Yogyakarta yaitu di keperawatan keluarga. Hal ini karena salah satu aspek penting dalam keperawatan adalah keluarga.
Untuk menjadi seorang perawat vokasi yang profesional, mahasiswa Akper YKY Yogyakarta harus menempuh studi selama 6 semester dengan batas maksimal 10 semester dan menyelesaikan 120 SKS. Pada setiap semester, mahasiswa wajib menyelesaikan beban studi yang telah ditentukan dalam bentuk kuliah, diskusi, responsi, tutorial, seminar, praktek di laboratorium, dan praktek klinik atau lapangan, serta bentuk lain yang sesuai. Akper YKY memiliki fasilitas berupa gedung yang representatif dengan ruang kuliah ber-AC yang nyaman serta staf pengajar yang berpengalaman. Selain itu, Akper YKY memiliki perpustakaan dengan koleksi buku umum dan bidang keperawatan serta pustaka digital yang menunjang perkuliahan mahasiswa. Fasilitas penunjang lain yang terpenting adalah laboratorium keperawatan, meliputi laboratorium keperawatan anak, maternitas, keperawatan gawat darurat dan manajemen bencana, keperawatan dasar, keperawatan jiwa, dan keperawatan medikal bedah dengan peralatan dan perlengkapan yang sesuai standar medis yang telah ditentukan. Dibimbing oleh staf yang mumpuni, diharapkan mampu mencetak tenaga perawat yang handal dan berdedikasi. Menjawab tantangan global, lulusan Akper YKY Yogyakarta tidak hanya dituntut menguasai ilmu keperawatan saja, tetapi juga mampu berbahasa asing yang baik. Oleh sebab itu, Akper YKY memiliki laboratorium bahasa sebagai penunjang perkuliahan. Didukung pula dengan laboratorium komputer yang sesuai dengan kebutuhan bidang medis. Akper YKY Yogyakarta juga memiliki Gria Sehat, sebuah tempat praktik yang menjalankan praktik asuhan keperawatan yang dilaksanakan oleh tenaga pengajar yang memiliki kompetensi melaksanakan praktik keperawatan. Gria Sehat melayani perawatan luka, konsultasi kesehatan, baby spa, pijat bayi, terapi holistik, dan pemeriksaan darah. Untuk meningkatkan kualitas pendidikan mahasiswa dan lulusannya, Akper YKY bekerja sama dengan Lincoln University.
Om Swastiastu, saya Direktur Politeknik Kesehatan Denpasar ingin menyampaikan terkait dengan institusi pendidikan Politeknik Kesehatan Kemenkes Denpasar. Ya, kita adalah merupakan unit pelaksana teknis Kementerian Kesehatan di bidang pendidikan.
Politeknik Kesehatan Kementerian Kesehatan Denpasar atau biasa disebut dengan Poltekkes Kemenkes Denpasar adalah institusi pendidikan tinggi kesehatan di bawah Badan Pengembangan dan Pemberdayaan Sumber Daya Manusia Kesehatan Kementerian Kesehatan Republik Indonesia yang menyelenggarakan program pendidikan Diploma 3, Sarjana Terapan, dan program profesi. Poltekkes Kemenkes Denpasar merupakan institusi pendidikan yang didirikan atas dasar Surat Keputusan Menteri Kesehatan Republik Indonesia tanggal 16 April tahun 2001. Poltekkes Kemenkes Denpasar memiliki 6 jurusan dan 11 program studi, di antaranya jurusan keperawatan, dengan program studi Diploma 3 Sarjana Terapan dan Profesi Nurse, memiliki unggulan kegawat daruratan dalam penanganan bencana, menghasilkan lulusan yang mampu berkomunikasi dalam bahasa asing, serta mampu menangani pasien gawat darurat dengan teknologi dan fasilitas modern. Jurusan Kebidanan dengan program studi Diploma 3 Sarjana Terapan Kebidanan dan Profesi Bidan, memiliki keunggulan asuhan kebidanan komplementer yang berorientasi pada budaya dan konsep Trihita Karana, memiliki fasilitas perkuliahan yang representatif dilengkapi dengan laboratorium ANC, INC, PNC, Neonatus, KB, Kespro, keterampilan dasar kebidanan, kegawat daruratan obstetri dan neonatus, komunitas, dan komplementer. Jurusan Kesehatan Gigi dengan program studi Diploma 3 memiliki keunggulan Dental Health Tourism, didukung fasilitas ruang kelas yang memadai, laboratorium yang representatif meliputi laboratorium preklinik, promotif preventif, kuratif, serta sarana pendukung seperti internet, perpustakaan, dan auditorium. Jurusan Gizi dengan program studi Diploma 3 dan Sarjana Terapan Gizi dan Dietetika, memiliki keunggulan mengembangkan pendidikan ke arah dietetik for tourism, mampu bersaing dalam skala nasional maupun internasional, didukung dengan fasilitas ruang kuliah yang memadai serta laboratorium yang representatif meliputi laboratorium biomedik, antropometri, pendidikan dan konsultasi gizi, analisis zat gizi, pengolahan pangan, dietetik kuliner, serta organoleptik. Jurusan Kesehatan Lingkungan dengan program studi Diploma 3 dan Sarjana Terapan Kesehatan Lingkungan, memiliki keunggulan menghasilkan lulusan yang mampu memonitoring kualitas fisik air, udara, tanah, makanan dan minuman, serta menganalisa dampak kesehatan lingkungan, didukung dengan fasilitas ruang kelas yang memadai serta laboratorium yang representatif meliputi laboratorium kimia, entomologi, fisika, mikrobiologi, komputer, bengkel kerja, serta ditunjang dengan fasilitas lain seperti perpustakaan, sarana olahraga, dan internet. Jurusan Teknologi Laboratorium Medis dengan program studi Diploma 3 dan Sarjana Terapan, memiliki keunggulan Tourism Medical Laboratory, didukung oleh fasilitas ruang kelas yang memadai serta laboratorium yang representatif meliputi laboratorium kimia, patologi klinik, parasitologi, mikrobiologi, dan mikologi. Poltekkes Kemenkes Denpasar menjadi institusi pendidikan yang unggul dengan beragam prestasi baik di tingkat lokal maupun nasional. Di antaranya penghargaan sebagai institusi dengan kerjasama internasional terbaik, dosen berprestasi tingkat nasional, pranatal laboratorium pendidikan terbaik, arsiparis terbaik, serta mahasiswa berprestasi tingkat nasional.
Untuk menunjang aktivitas pendidikan, penelitian, dan pengabdian masyarakat, Poltekkes Kemenkes Denpasar telah dilengkapi fasilitas terbaru seperti berikut. Auditorium yang terletak di Direktorat dan Kampus Pulau Moyo, ruang kelas yang memadai, laboratorium terpadu, mini hospital, perpustakaan terpadu, kendaraan operasional, serta lahan praktek yang sesuai dengan tujuan mata kuliah di mitra kerja Poltekkes, rumah sakit, puskesmas, industri yang relevan. Untuk mengembangkan kreativitas dan meningkatkan prestasi mahasiswa, Poltekkes Kemenkes Denpasar menyelenggarakan beberapa unit kegiatan mahasiswa, yaitu PIKM, KSR, Mapala, kegiatan ilmiah, tari, UKM Tabuh, paduan suara, English Club, kewirausahaan, pramuka, voli, basket.
Bagi adik-adik yang ingin bekerja di luar negeri pada sektor kesehatan, Ditunggu kehadirannya di Poltekkes Kemenkes Denpasar. Raih suksesmu bersama kami.
Cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru.
Bisa, kan pakai Kris. Jadi mudah.
Mulai eksplorasi cara tarik tunai baru.
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
Mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Salah! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live calls, kirim digital kado,
Bayar tagihan rutin, top up e-wallet.
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Tablus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktifasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
Mulai bisa apa aja sekarang.
cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru.
Bisa, kan pakai Kris. Jadi mudah.
Mulai eksplorasi cara tarik tunai baru.
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
Mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Salah! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live calls, kirim digital kado,
Bayar tagihan rutin, top up e-wallet.
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Tablus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktifasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
Mulai bisa apa aja sekarang.
cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru.
Bisa, kan pakai Kris. Jadi mudah.
Mulai eksplorasi cara tarik tunai baru.
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
Mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Salah! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live calls, kirim digital kado,
Bayar tagihan rutin, top up e-wallet.
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Tablus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktifasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
Mulai bisa apa aja sekarang.
cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru.
Bisa, kan pakai Kris. Jadi mudah.
Mulai eksplorasi cara tarik tunai baru.
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
Mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Salah! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live calls, kirim digital kado,
Bayar tagihan rutin, top up e-wallet.
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Tablus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktifasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
Mulai bisa apa aja sekarang.
cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru.
Bisa, kan pakai Kris. Jadi mudah.
Mulai eksplorasi cara tarik tunai baru.
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
Mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Salah! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live calls, kirim digital kado,
Bayar tagihan rutin, top up e-wallet.
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Taplus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktivasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
Mulai bisa apa aja sekarang.
cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru,
Bisa kan pakai kris, jadi mudah.
mulai eksplorasi cara tarik tunai baru,
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Gala! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live goals, kirim digital kado,
Bayar tagihan rutin, top up e-wallet.
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Taplus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktivasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
Mulai bisa apa aja sekarang.
cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru,
Bisa kan pakai kris, jadi mudah.
mulai eksplorasi cara tarik tunai baru,
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Gala! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live goals, kirim digital kado,
Bayar tagihan rutin, top up e-wallet.
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Taplus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktivasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
Mulai bisa apa aja sekarang.
cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru,
Bisa kan pakai kris, jadi mudah.
mulai eksplorasi cara tarik tunai baru,
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Gala! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live goals, kirim digital kado,
Bayar tagihan rutin, top up e-wallet.
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Taplus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktivasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
Mulai bisa apa aja sekarang.
cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru,
Bisa kan pakai kris, jadi mudah.
mulai eksplorasi cara tarik tunai baru,
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Gala! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live goals, kirim digital kado,
Bayar tagihan rutin, top up e-wallet.
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Taplus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktivasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
Mulai bisa apa aja sekarang.
cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru,
Bisa kan pakai kris, jadi
Acara ini didukung oleh 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 Acara ini didukung oleh
Tari Cakra Ancala. Tari Cakra Ancala berakar dari kehidupan masyarakat sekitar Gunung Merapi di daerah kawasan istimewa Yogyakarta yang dikemas menjadi karya pertunjukan tari kelompok dengan suasana gagah, berwibawa, lembut, dan gaduh seirama. Musik pengiring, pola lantai, rias, dan busana, serta properti yang sesuai sehingga dapat diapresiasi dan dimengerti makna dari tarian ini. Keselamatan, kesejahteraan, dan kebersamaan merupakan harapan dari kehidupan manusia di alam semesta. Menghormati serta mengenang perjuangan dan keluhuran budi pendahulunya merupakan simbol ketulusan masyarakat. Keluasan, kelincahan, kerampakan, dan sikap menembah merupakan ciri khas tarian ini. Terinspirasi dari keeksotisan Gunung Merapi yang dipandu dalam kemasan bentuk estetika, gerak ritmis yang indah dengan perpaduan iringan yang runtut, maka terciptalah karya tari Cakra Ancala.
Acara ini didukung oleh 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 Acara ini didukung oleh
Welcome to Poltekkes Kemenkes Palembang, Health Polytechnic of the Ministry of Health Palembang, better known as the Poltekkes Kemenkes Palembang, is one of the high educational institutions in South Sumatra. It was established in 2001 based on the decree of the Menkes Kesos RI number 298 Menkes Kesos /SK/4/2001 dated on April 16, 2001. The main office is located on Jalan Jenderal Sudirman, kilometer 3.5, number 13 and 65, Muhammad Hussein Hospital Complex, Palembang.
The vision of Poltekkes Kemenkes Palembang, becoming a superior and dignified health higher education institution at the national level in 2024. To reach the vision, Poltekkes Kemenkes Palembang has formulated 3 missions, implementing qualified Tridharma perguruan tinggi on the basis of ethical and moral values, following science and technology development, implementing good institutional governance through the use of the information and technology, widening mutual partnership for institutional development.
Poltekkes Kemenkes Palembang currently has 15 study programs distributed throughout South Sumatra Province, which located in Palembang, Muara Enim, Batu Raja, Lubuk Linggau, and Lahat.
All the study programs, a 3-year diploma and a 4-year diploma programs, have been accredited by LAMPTKES, Lembaga Akreditasi Mandiri Perguruan Tinggi Kesehatan Indonesia. The study programs are a 3-year and a 4-year diploma program in nursing, a 3-year and a 4-year diploma program in midwifery, a 3-year diploma program in nutrition, and a 4-year diploma program in nutrition and dietetics, a 3-year diploma program in pharmacy, a 3-year and a 4-year diploma program in medical laboratory technology, a 3-year diploma program in dental health, a 3-year diploma program in sanitation.
Poltekkes Kemenkes Palembang is supported by high-speed Wi-Fi connection and also developed an AMS, Academic Management System, an application that helps lecturers and students in the learning and teaching process digitally, especially during pandemic.
Poltekkes Kemenkes Palembang has standardized computer-based test center, which can be used for the competency test and student admission. Poltekkes Kemenkes Palembang has an active role in providing health education, especially to the society of South Sumatra. To increase the capacity of teaching staff and students, Poltekkes Kemenkes Palembang continues to conduct online and offline workshops. Continuing innovation has been capable to be at the national level and has received the numerous awards. Awarding Corruption-Free Institution WBK in 2020. Awarding the Public Service Obedience Grade B in 2020. Outstanding lecturers, outstanding students,
Good afternoon, ladies and gentlemen. There is an information we want to announce to you that our session today is supposed to be Mr. Wikan Sakarinto, But unfortunately, he already told us that he felt really sorry because he aren't able to be with us in this venue right now. Because of that, his presence will be changed with Dr. Benny Bandana Jaya, STMT, the Director of Vocacy and Profession, Ministry of Research, Technology, and Higher Education. We want to inform you that Dr. Benny is now still on the way from the meeting with the Minister of Education. That's why our next session is able to start at 2 p.m.
Baik, kepada Bapak Ibu sekalian, para peserta, dikarenakan Bapak Benny sedang dalam perjalanan dari rapat dengan Menteri Pendidikan, oleh karena itu sesi selanjutnya akan dilanjutkan pada pukul 2 siang. Terima kasih.
Acara ini didukung oleh
FDC is a dental clinic that combines a unique concept, comfort, friendliness, and technological sophistication. FDC Dental Clinic exists as a solution to the unaffordable dental services and people's terrifying stigma of going to the dentist. FDC Dental Clinic already has 15 branches spread across DKI Jakarta, Bogor, Depok, Tangerang, Bekasi, Bandung, Surabaya, Yogyakarta, and will expand throughout Indonesia. Our vision is to become one of the best dental clinic with good service and to put a smile on our beloved patients. Therefore, we have 7 missions. We develop a competent team by creating excellent quality and standardized services. We also provide every aspects of our service professionally. We provide integrated health services oriented to patient and family needs. We prioritize teamwork on patients' satisfaction and safety oriented. We provide a clean and hygienic work environment. We serve the best solution for patient through the great quality services and affordable prices. We develop a friendly and caring team who treats patients as family. We have 4 company values: integrity, quality, learn and growth, grateful and abundant. To build a happy team, we also have some fun events, like outing or gathering, themed costumes, CSR programs, and National Day events. To develop team skills, we have training programs, both for soft skills or hard skills. This is our clinic. And now, it's time for you to join us.
Om Swastiastu, saya Direktur Politeknik Kesehatan Denpasar ingin menyampaikan terkait dengan institusi pendidikan Politeknik Kesehatan Kemenkes Denpasar. Ya, kita adalah merupakan unit pelaksana teknis Kementerian Kesehatan di bidang pendidikan.
Politeknik Kesehatan Kementerian Kesehatan Denpasar atau biasa disebut dengan Poltekkes Kemenkes Denpasar adalah institusi pendidikan tinggi kesehatan di bawah Badan Pengembangan dan Pemberdayaan Sumber Daya Manusia Kesehatan Kementerian Kesehatan Republik Indonesia yang menyelenggarakan program pendidikan Diploma 3, Sarjana Terapan, dan program profesi. Poltekkes Kemenkes Denpasar merupakan institusi pendidikan yang didirikan atas dasar Surat Keputusan Menteri Kesehatan Republik Indonesia tanggal 16 April tahun 2001. Poltekkes Kemenkes Denpasar memiliki 6 jurusan dan 11 program studi, di antaranya jurusan keperawatan dengan program studi Diploma 3, Sarjana Terapan, dan profesi nurse. Memiliki unggulan kegawat daruratan dalam penanganan bencana, menghasilkan lulusan yang mampu berkomunikasi dalam bahasa asing, serta mampu menangani pasien gawat darurat dengan teknologi dan fasilitas modern. Jurusan kebidanan dengan program studi Diploma 3, Sarjana Terapan Kebidanan, dan profesi bidan, memiliki keunggulan asuhan kebidanan komplementer yang berorientasi pada budaya dan konsep Trihita Karana. Memiliki fasilitas perkuliahan yang representatif, dilengkapi dengan laboratorium ANC, INC, PNC, Neonatus, KB, Kespro, keterampilan dasar kebidanan, kegawat daruratan obstetri dan neonatus, komunitas, dan komplementer. Jurusan Kesehatan Gigi dengan program studi Diploma 3 memiliki keunggulan Dental Health Tourism, didukung fasilitas ruang kelas yang memadai, laboratorium yang representatif meliputi laboratorium preklinik, promotif preventif, kuratif, serta sarana pendukung seperti internet, perpustakaan, dan auditorium. Jurusan Gizi dengan program studi Diploma 3 dan Sarjana Terapan Gizi dan Dietetika, memiliki keunggulan mengembangkan pendidikan ke arah dietetik for tourism, mampu bersaing dalam skala nasional maupun internasional, didukung dengan fasilitas ruang kuliah yang memadai serta laboratorium yang representatif meliputi laboratorium biomedik, antropometri, pendidikan dan konsultasi gizi, analisis zat gizi, pengolahan pangan, dietetik kuliner, serta organoleptik. Jurusan Kesehatan Lingkungan dengan program studi Diploma 3 dan Sarjana Terapan Kesehatan Lingkungan memiliki keunggulan menghasilkan lulusan yang mampu memonitoring kualitas fisik air, udara, tanah, makanan dan minuman, serta menganalisa dampak kesehatan lingkungan, didukung dengan fasilitas ruang kelas yang memadai serta laboratorium yang representatif meliputi laboratorium kimia, entomologi, fisika, mikrobiologi, komputer, bengkel kerja, serta ditunjang dengan fasilitas lain seperti perpustakaan, sarana olahraga, dan internet. Jurusan Teknologi Laboratorium Medis dengan program studi Diploma 3 dan Sarjana Terapan memiliki keunggulan Tourism Medical Laboratory, didukung oleh fasilitas ruang kelas yang memadai serta laboratorium yang representatif meliputi laboratorium kimia, patologi klinik, parasitologi, mikrobiologi, dan mikologi. Poltekkes Kemenkes Denpasar menjadi institusi pendidikan yang unggul dengan beragam prestasi baik di tingkat lokal maupun nasional. Di antaranya penghargaan sebagai institusi dengan kerjasama internasional terbaik, dosen berprestasi tingkat nasional, pranatal laboratorium pendidikan terbaik, arsiparis terbaik, serta mahasiswa berprestasi tingkat nasional.
Untuk menunjang aktivitas pendidikan, penelitian, dan pengabdian masyarakat, Poltekkes Kemenkes Denpasar telah dilengkapi fasilitas terbaru seperti berikut. Auditorium yang terletak di Direktorat dan Kampus Kolomoyo, ruang kelas yang memadai, laboratorium terpadu, mini hospital. perpustakaan terpadu, kendaraan operasional, serta lahan praktek yang sesuai dengan tujuan mata kuliah di mitra kerja Poltekkes, rumah sakit, puskesmas, industri yang relevan. Untuk mengembangkan kreativitas dan meningkatkan prestasi mahasiswa, Poltekkes Kemenkes Denpasar menyelenggarakan beberapa unit kegiatan mahasiswa, yaitu PIKM, KSR, Mapala. Kegiatan ilmiah, tari, UKM Tabuh, paduan suara, English Club, kewirausahaan, pramuka, voli, basket.
Bagi adik-adik yang ingin bekerja di luar negeri pada sektor kesehatan, ditunggu kehadirannya di Poltekkes Kemenkes Denpasar. Raih suksesmu bersama kami.
Bu Bella, kamu kan udah tahu di masa pandemi gini tuh jangan bayar pakai cash. Bayar pakai cash nanti lagi deti sini virus kabeh. Hari gini tuh pakai tuh BNI mobile banking. Kilo tak jari mlebu wis ngetik pin to ora, aku iki guru nganggo face recognition, rasa copot masker. Oh jelas, HP ini mantep deh. Prof Piku sini anake. Ya kan anakku kok anake.
Oh bisa pasang foto juga.
Oh
ya?
jelas, BNI mobile banking. Terus yang bayar nganggo QR code. Wih, kayak Mas Cingok saudarane to Oh, garis di-scan. Loh, mantep to. Wis iki jenenge mantep BNI mobile banking. Wis tak bayar iki nggo tipe. Terima kasih. Oh tak kasbonke yo.
Thank you ya, Pak.
Bojomu kan kerja ora aku. Assalamualaikum. Bella, gimana Bel?
Pak, sekarang udah pakai digital bank loh.
Yang baru itu?
Iya, yang lagi happening itu.
Yang katanya satu akun bisa 2 rekening?
Iya.
Masuknya kamu pakai PIN atau pakai sidik jari?
Yang biasanya itu, Pak.
BNI mobile banking sudah pakai face recognition.
Buat ngerencanain liburan itu kan?
BNI mobile banking juga bisa. Live goal namanya. Udah gitu tarik tunainya tanpa perlu kartu. Kita kalau bayar-bayar tinggal pakai QR code. Gak ribet, rekeningnya banyak, BNI juga bisa. BNI mobile banking, BNI-nya sendiri udah 75 tahun melayani Indonesia. Percaya tuh sama yang pasti-pasti, apalagi mengolah uang. Udah pakai BNI mobile banking aja.
Yaudah, aku download mobile bankingnya BNI.
Ya, karena kamu pakai BNI mobile banking, yang kali ini tak bayari aja. Wah, tas dulu dong.
Iya.
Pandemi ya, gas langsung gas.
Adik Anda sudah saya selamatkan. Nggak punya. Kalau begitu bikin deh. Bang jauh. Terus? Udah malam. So, takut.
Hari gini nggak ada alasan lagi buat rempong bikin rekening tabungan. Download dan buka aplikasi BNI Mobile Banking. Klik daftar. Baca syarat dan ketentuan. Lengkapi data diri, lalu klik selanjutnya. Lakukan selfie, ikuti ekspresi wajah yang diminta, netral, senyum, kaget, buka tabungan BNI dan tingkatkan transaksi di BNI Mobile Banking nggak pakai nanti.
Bu Bella, kamu kan udah tahu di masa pandemi gini tuh jangan bayar pakai cash. Bayar pakai cash nanti lagi deti sini virus kabeh. Hari gini tuh pakai tuh BNI mobile banking. Kilo tak jari mlebu wis ngetik pin to ora, aku iki guru nganggo face recognition, rasa copot masker. Oh jelas, HP ini mantep deh. Prof Piku sini anake. Ya kan anakku kok anake.
Oh bisa pasang foto juga.
Oh
ya?
jelas, BNI mobile banking. Terus yang bayar nganggo QR code. Wih, kayak Mas Cingok saudarane to Oh, garik di scan. Oh, mantep toh. Wis iki jenenge mantep BNI Mobile Banking. Wis tak bayari iki nggo tipe. Terima kasih. Aku tak kasbonke yo.
Thank you ya, Pak.
Bojomu kan kerja ora aku. Assalamualaikum.
Cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru.
Bisa, kan pakai Kris. Jadi mudah.
Mulai eksplorasi cara tarik tunai baru.
Ya bisa lah. Dengan mobile tunai, gak perlu ribet.
Mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Salah! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja. Bisa investasi, buat live calls, kirim digital kado,
Bayar tagihan rutin, top up e-wallet.
dan berbagai fitur untuk transaksi lainnya. Aku aja punya BNI Tarlus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktivasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
Mulai bisa apa aja sekarang.
Acara ini didukung oleh
Cuma rebahan, tapi bisa bikin perubahan. Waktunya mulai bisa apa aja dari satu aplikasi. Mulai adaptasi cara bayar baru.
Bisa, kan pakai Kris. Jadi mudah.
Mulai eksplorasi cara tarik tunai baru.
Ya bisa lah.
Dengan mobile tunai, gak perlu ribet.
Mulai melihat potensi bisnis baru.
Bisa dong. Transfer luar negeri cukup dari sini.
Oh, itu aja ya?
Salah! BNI Mobile Banking punya banyak fitur yang buat kamu bisa apa aja.
Bisa investasi, buat live goals, kirim digital kado,
Bayar tagihan rutin, top up e-wallet.
Dan berbagai fitur untuk transaksi lainnya.
Aku aja punya BNI Tarlus dan BNI Mobile Banking.
Yuk, buka tabungan dan aktivasi sekarang.
Cukup selfie.
Dengan tampilan BNI Mobile Banking baru,
Mulai bisa apa aja sekarang.
Ladies and gentlemen, welcome back to the 8th International Conference on Health and Sciences, live from East Park Hotel, Yogyakarta. Since it's already 2 p.m., we will proceed to the keynote session 2 with Dr. Benny Bandanajaya, the Director of Vocacy and Profession, Ministry of Research, Technology, and Higher Education.
In this session, we will be guided by Mr. Agus Karmayana, MPH, from Health Polytechnic, Ministry of Health, Yogyakarta. To know him better, let me introduce his profile from his CV. His name is Mr. Agus Karmayana, and usually called Mr. Yana. He born in Jakarta, 12 August 1966, and his position is head PPM of Health Polytechnic, Ministry of Health, Yogyakarta, and his study is program doctor and Health Faculty of Kesehatan Masyarakat.
And the second education is Master of Public Health, School of Population Health, the University of Melbourne in Australia in 2007. And also the third education is Bachelor Degree in Public Health Faculty of Indonesian University in 1999. And his recent work from 2002 until now is the lecturer in environmental health in Health Polytechnic, Ministry of Health, Yogyakarta. For Mr. Yana, the time is yours.
Okay, thank you, my fellow MCs. Good afternoon, ladies and gentlemen, and all the participants for the 8th ICHS today. So welcome to the third plenary session that will be held in this session. As mentioned before by the MCs, that we will discussing about the role of vocational colleges in realizing a healthy city. These topics will be delivered by Dr. Benny Bandanajaya. So he already joined in this Zoom meeting. We will share a glance about his curriculum vitae. So his full name is Dr. Benny Bandanajaya, Sarjana Teknik, Magister Teknik. His position now, currently, he is the Director of Vocational and Professional Higher Education of the Ministry of Education, Culture and Research and Technology of Republic of Indonesia. About his academic background, he graduated in level Diploma 3 in 1993 and from Polytechnic Manufacture Bandung or Polman Bandung, from metal casting engineering study program, and he also graduated from Institute Technology Bandung for his bachelor, magister, and also the doctor degree. All the three is about mechanical engineering, and from his doctor degree is about material science and engineering. About occupation experiences, he started in 1993 as the staff engineering at PT Hanko Foundry Industry, and start from 1995 up to 2020. He is the Vice Director for academic affair in Polman Bandung, and start from 2020 up to now, he becoming the director of vocational and professional higher education in the Ministry of Education and Culture, Research and Technology. So I want to greet Dr. Bandandan Jaya. Good afternoon, sir.
Well, good afternoon, Pak.
Ya, selamat
Pak
siang,
Yana.
Bapak. Oke.
Yeah.
Thank you very much for joining our session today. So, Pak Bandandan Jaya, the allocation time for you to giving the presentation is up to 30 p.m., Pak.
Yeah.
Yeah. So, I will hand over the time to you from now. Please, Pak.
Okay, thank you, Pak Yana, for the time. You are the director of Poltekkes Kemenkes Yogyakarta, also all vice director and all keynote speakers, and especially all participants which are attending this seminar or international seminar. Thank you very much for the invitation. Firstly, I want to apologize for Pak Wikan because he has a very important meeting with our ministry, so he gave this presentation to me. I will give some presentation about link and match of vocational higher education and working world, or in Indonesia we call it DUDI, Dunia Usaha Dunia Industri. As following this topic that I will talk about how to make workforce from vocational higher education. First, we can see in this data, we realize that our human resource in health sector during pandemic is very not good in condition, because you know that Indonesia still need a large number of health workers. Yeah, as we see in this map, we know that in Java, we can see that there is so many health workers, but in outside Java, we still need a very large number of health workers. So as a Ministry of Education, we have a responsibility how to build or how to push the producing of our graduates from health sector. So this is another data that we have a target of Indonesia health personnel ratio by 2025. Indonesia needs 100,000 of health workers to ensure that our Indonesians will have an access to equal health services. We have 250 million Indonesians, and of course, for this so many people, we have to preparing a good health workers in Indonesia. Indonesia population is spread over 2,000 sub-districts and over 7,000 sub-districts and 74 villages in Indonesia, which are located more than 2,030 inhabited in island. And you know that as we see in this map, yeah, we can see that only in Java that the people have sufficient health workers. in the other side, we have opportunity to have a fairly large people, because in 2030, the dependency ratio of Indonesian people have low. It means that the people with in productivity condition or in productivity age is very large number. You know, in Southeast Asia, Indonesian has highest percentage of people in productive age. So we have to preparing that all of these people of Indonesian has a competence, has some specific skill, or we have to prepare them to be in good condition, and we can preparing in education system. Indonesian is the fourth most populous country in the world, around 250 million. As you know, it is the amount of our population in Indonesia. And the younger population is under 30 years is very in a large number. So Indonesian population currently consists of a large number of labor force or workforce. This is an opportunity to us to make them as a labor force, and of course we have to preparing in our education system, and we have to push the people in Indonesia to have an access to our education system. So if they have an higher education system, so I think they have a good skill and can improve the economic growth in Indonesia. And to ensure the this condition, so we have to build how to make a good education system which is related to industry or related to workforce, work world, and every graduate ready to give their skill to help and to make an economic growth. Yeah. Okay. This is the schematic of study and work. Yeah. The graduates, after they graduate from school or from college, they need a job. In the other hand, the industry needs human resource. The industry has a standard of high skill competence, yeah, and there is still a problem. The problem about how the graduate quality versus industrial needs of human resource. We have know that if the graduates ready and have a high skill competence which is standardized by the industry or the work world, I think there is no problem to graduates to get in the job on the industry or the work world, or in the hospital maybe for the workforce health sectors. And then we call it that we have to build some a link and match between our education system with the working world standard competence needed, because you know, after the student going to our university or our polytechnic, they give a process, and when they are graduated from our polytechnic, they seek for works, or they seek a job, or maybe they start an entrepreneur, and also they maybe pursuing studying in the higher level. The most of our graduates is looking for work, so we have to find and to link and to match the working world standard competence to our process in our education system in Polytechnic. So the curriculum, the method, the facility, the funding, our lecturer and technician material, all of them should be matched with the standard or working world needed. Yeah, you know, if there is link and match condition, so the curriculum will match with the standard of working world, and then the student will learn about how to work in the industry after they graduate. So they will not have a difficulty to fill in the industry. In the other side, we have the situation in this in this condition now. We have a society 5.0. This means that the human-centered society to balance economic advance with the resolution of social problems by a system that highly integrated with cyberspace and physical space. As we know that the Internet of Things, we are now dependent to the internet. So every single condition, so we have the connection internet. Yeah, in the current society, the IoT will connect all people. Yeah, we know that today we very easy to connect with another people with our gadget or with our cellular phone. And you know that there is a possibility, yeah, to open human with robot, yeah, automatic, and another condition that not need a lot of people. With one robot, maybe he can replace more than 5 or 10 people. So this situation will make us think that we have to have a good skill. Yeah, because if we don't have any skill or special skill, so we can replace it by the robot. And then this is the fact or the reality of the society of 5.0 that we have now in the modern situation. And our student and our people should have preparing to face that condition in the future. So this is the condition of disruptions. What is the condition? Disruption means new technology as internet, social, mobile, cloud, big data, 3D printing, renewable energy, etc. will give some disruption to us. Yeah, disruption means something not familiar with us, and if we cannot adapt to this new technology, so we will not in a good condition, and we call it a valley of death, the shape of curve that symbolize the breakthrough technology in the absence of their adaptation. The key is adaptation. Yeah, can lead a collapse of existing economic model. So if we cannot adapt we cannot adapt the current conditions, so we can collapse. Yeah, so we have to build another disruptive scenarios such as smart grid, connected cars, maybe smart home, next generation education, etc. As he said, for us to give a new condition, and of course we can continue our life in the better condition. This is our profile. The Directorate General of Vocational Education, or DIGSI, has a Directorate of Vocational Higher Education with 2002 campus, yeah, which is coverage of polytechnic, community college, yeah, academy, and also university, institute, and college with vocational study program. We also have a medium level of or higher education of SMK, yeah, vocational high school, with 14,000 SMK, and we also have Directorate of Training and Course with 17,000 institutions, and we should we have a main strategy that we should meet the minimum condition of marriage, yeah, marriage between industry and the education and the institution of education, or with a polytechnic, or with SMK, with yeah, with institution of training and course, yeah, link and match marriage, not only MOU signing, yeah. But marriage mean that the MOU, after MOU, we build some program, how to make a program to link and match with the industrial needs, yeah. This is a condition that vocational education as national strength through increasing, yeah, competence of student and vocational graduate in accordance with industrial needs. This is our main strategy, that link and match with industry is one of the key how to give some education to students, and after they graduate, they're ready to work in the industry. Yeah, this is age program. We call it H+E, link and match strategy. The first one is curriculum. Curriculum is synchronized with industry, and we have to discuss with industry to build the curriculum, so the curriculum will cover the competence which is needed by the industry. The number two is project-based learning with industry or with working world. There is some project maybe from industry, and the project will be given to the student. The student is involving this project, and they of course they can learn about how to solve the problem from the industry. And for this methods, the student will know the condition of what is the condition of industry or the work world, and they will learn about how to work and the solving of problem in industry. The third is visiting teachers. Yeah, the polytechnic should inviting, yeah, some of the practitioners from industry or from work world, or maybe from hospital, or for teach our student, so they can teach about how work in the real world, and the student will learn about how the technology in the latest condition in this the current situation. And then the teacher from industry will the student will discuss about the condition of industry, and the student will learn about industry in the current situation. Another program is internship. Internship means that we send the student to the industry or to hospital or to puskesmas or to clinic and another facility which can they can work there for maybe 1 semester or 6 months. So they can learn about how to work in the real condition, yeah, with, of course, with a professional there, and they can be an assistant, yeah, and learn about how to work and implement it. They knowledge about which is learned in campus. Another is certificate of competence. Certificate of competence means that we have to give some certificate which is standardized and needs by the industry. So the graduates will have a very good point, yeah, because they have a certificate of competence. Beside of certificate of certificates of education from the university or for polytechnic, yeah, or ijazah, yeah, we call it ijazah. Another program is training by industry. Training I mean that the training for, yeah, teacher and lecturer. The teacher, the lecturer should have also an experience to work in the real world in industry or maybe in a hospital, and they can get updates condition, yeah. So they can, from the updates, they can give a lecture for the student with the current situation and current condition. So the student will, the teacher and lecturer will have a new mindset and new vision and new point of view about the condition in this the latest condition in our industry and working world. Another is applied research support by teaching factory and teaching industry. It is a very good condition if the polytechnic can build some teaching factory or teaching industry. So the research from the lecturer can be implemented in this teaching factory or teaching industry or teaching hospital or teaching puskesmas or teaching clinic or another name, yeah, which is the facility for student and for the lecturer work together to have a project maybe, or to make some research, yeah, with industry, and then they have an experience how to make a solution, yeah, for the problem from industry or from the workforce, yeah. Another concept of vocational education development is we continue to revitalize the transformation of vocational education with the spirit of Merdeka Belajar, ya, Kampus Merdeka, Pelajar Pancasila, and Link and Match 8.I, ya. The Merdeka Belajar or freedom of learn is the concept of that we know that the student has a unique talent, yeah. They has a passion, they has an aspiration, maybe cannot find in their study program. So they can they give of freedom to choose multiple pathway, yeah, to develop their own competence. This is call it a flexible concept, yeah, flexible concept of learning, yeah. So the student can learn about their patient. And for Merdeka Belajar, we can give them a maximum of 2 semesters experiential learning in outside of campus, yeah, and 1 semester maybe in outside the study program. They can learn in another study program in the campus. So this is the condition that all of this concept, we hope that every graduates will have a readiness to work in the work in the industry, yeah, and of course it will support the economic growth in Indonesia. Okay, I think that's all my presentation for this session. Thank you very much. I give to Pak Yana again. Thank you.
Okay, thank you, Pak Benny, for your informative presentation. So we still have about 30 minutes to go to question and answer or the discussion. So everybody that want to ask something can raise their hands or maybe write down in the chat box. There is already one question in the chat box, Pak Benny. Maybe I can read it for you. Okay. This is from Anita. So good day, Pak Benny. I'm Anita. I would like to ask you about your data on target of Indonesia health personnel ratio 2025 on the slide presentation. It shows many kinds of medical practitioners such as medical doctor, nurse, and so on. The question is, he is asking about the medical laboratory technologies. Is it? I think you can answer it.
Okay, thank you, Ibu Anita, for your question. So the data came from the sources. Sorry, I will check. Yeah, Kemenko Kesra on 2080. So I think it should be updated because in vocational study program there is so many specialized in the name of study program in vocational. Yeah, as you say that medical laboratory technologies is I think also required for running, for the laboratorium equipment maybe, and every hospital I think they need this skill, this work for skill. So I'm sorry that I have not the data yet. Maybe if there is some opportunity to me to find the data, so we can discuss it later. Thank you very much.
Yeah. So there are two people that asking about this, but I think this is not to worry too much, Pak Benny. Yeah. So I think
because the medical laboratory maybe the medical laboratory maybe is not familiar with the Menko Kesra. They're familiar with the doctor, nurse. So I think this is a special skill for
because there are so many health professionals there. Thank you, Pak Benny. There is another question in the chat box coming from Ibu Almira. Is there any adjustment in Merdeka Belajar concept for health education? Because health education system has rigid and very specific competencies, or it will be different to other study program, for example, engineering program and so on. Yeah. So there is any differences between
Okay. Actually, for health education is very rigid. I know that this is not easy to implement the Merdeka Belajar concept. But in the other hand, the health education can be use some of the Merdeka Belajar concepts. Yeah, I said that we call it for social work. Yeah, social work in this pandemic condition. There is so many needs about nurse for vaccination maybe, and our student can involve in this social works. So this also a Merdeka Belajar program, yeah. So in health education system, I think the rigidness can be flexible to be implemented in Merdeka Belajar, such as I say that for maybe for work social works, yeah, in this pandemic condition. So the student can have an experience how to how to implement the skill, and how to maybe interaction with another partner in the social works. Yeah, I think that's all, Pak Yana. Thank you.
Mungkin masih ada yang ingin bertanya di sana, bisa dalam bahasa Indonesia, silahkan. Bisa raise hand. Di sini ada peserta dari beberapa Poltekkes juga, Pak Beni. Jadi mungkin ada teman-teman dari Poltekkes lain selaku peserta maupun co-host yang ingin bertanya, silakan. Ibu Ira? Ya, Ibu Ira dari Poltekkes Palembang. Silakan Ibu Ira.
Ya, thank you.
Committee, maybe Bu Ira can be unmuted the microphone. Bu Ira, your microphone is still mute. Bu Ira? Yeah, maybe you can repeat your question, Bu Ira. Yeah, because